that ain't
And there's a whole eviction process if she doesn't
probably
go.
part of our appropriation.
Right.
So
Yeah, it was the appropriation.
that's what I would.
And that's one of the reasons too.
I'll start
Once
sending
COVID
you
hit and
cards.
they started.
Okay, we're all set.
Approving my budget.
And you can't do anything about it.
Good morning, everyone. I'd like to call the Meeker County Board of Commissioners regular session for Tuesday, March 18th to order. Would you please join me in the pledge? I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, we'll start off with the public comment period. Is there anyone from the public who would like to make comment? Hearing none, we'll move on to the board agenda. Mr. Administrator, is there any changes or updates?
Yes, we do have one addition from when it originally came out, and that is approval of a letter in support of a project that Clay County is looking to have approved.
Okay. Any other additions?
Mr. Chair, I'll move the agenda as presented with the amendment.
Okay, we have a motion by Commissioner Schmidt. Is there a second?
Second.
Second by Commissioner Samke. Is there any further discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Tim, you have someone to introduce to us.
Maybe. Sure. Yes. It just seemed like a couple months ago, I was here asking to transition the position to an assistant, and it's really nice to come back and introduce the new assistant veteran service officer. And some of you I know have met him already. His name is Tanner Eberlin. Did I get that right? Yep. Okay.
How long you been working with him?
My question.
Tanner, I'd be a little.
Don't ask me. Or my wedding date, or my wife's birth date, so.
You better stop.
This isn't being recorded, is it?
Yes, it is.
So Tanner grew up in Litchfield here, graduated from high school here, and then decided to go into the Marine Corps and follow his grandfather. Is that right? His grandfather was in the Marine Corps as well during the Vietnam era. So he spent 4 years in the Marine Corps, deployed to Afghanistan and Okinawa and Korea. Is that correct? Okay. And then he came back to Minnesota after his 4 years in the Marine Corps, joined the Minnesota Army National Guard, got married somewhere in the process, right?
Married in 2015, so I was still in the Marine Corps.
Oh, you're still in the Marine Corps.
You know your
Okay.
date. I'm
Yes, he does.
Yeah.
That's good.
I wouldn't
Good sign.
Maybe we shouldn't trust all the data.
You're on to something, Steve. So, really happy to have Tanner on board. He is, when he got out of the Marine Corps, came back, he joined the Minnesota Army National Guard and deployed again to Afghanistan.
No.
No, oh, no, sorry, not Afghanistan, Somalia and Djibouti, is that right?
Yep.
Okay. And is still currently in the Minnesota Army National Guard as an instructor at the Regional Training, is it Institute? At Camp Ripley. So, and you know what, on top of that, he walks to work. He lives right in town here with his family, so if you see him out there, say hi to him somewhere, or give him a ride if it's bad weather. But, just really happy to have him on board as the Assistant Veteran Service Officer, and looking forward to when he completes his training. And by the way, he has completed what's called TRIP training, so he's got one more piece of training to do, and then he will be fully accredited as a Veteran Service Officer.
Good.
Great.
In short
Good,
order. So.
good.
Wonderful.
Great.
Well, welcome, Tanner. Glad to have you on board.
Thank you.
Do you like public speaking? Is there still looking for somebody in Darwin for Memorial Day? They need to speak, only 10 minutes. But welcome. Anyone have any questions for Tanner? Or?
No, I stopped in and visited him one day, just introduced myself, so see how.
Okay.
Met him in the hallway, but welcome. Thank you for your service. It sounds like you've been. And you were in the Marines, I understand?
Yes.
Good for you. Versus, what were you in, Tim?
I don't know. The Army side of things.
Thank you both for your service. I appreciate it. Welcome.
Thank you.
Are you looking forward to the challenge here, or?
I am. I'm not a big office person usually. I've been infantry my entire military
Yeah.
career, so office is a little bit of difference, so.
No, I think they're gonna love this, so thank you.
We
Well,
appreciate it.
what we'd really like to hear is that you hope to be here for the next 35 years.
You don't have to,
plan.
you don't have to commit to that. We got that on tape.
Yeah, there's no backing out now.
No,
That's contractual.
thank you.
All right,
Thank you.
Thanks.
Nice to meet you. Mr. Letson, consent agenda, would you like to run it for us, please?
Yes, we have approval of the March 4th board meeting minutes, approval of the Health and Human Services County and Hospital accounts payable, approval of a contract with WaterGuard LLC for watercraft inspections, approval of a donation to the Minnesota DNR for a mini biff at Lake Manuela, approval of a club on-sale liquor license renewal for the Cedar Mills Gun Club, approval of a consumption and display permit renewal for Riverside Store and Tavern, approval of a temporary on-sale liquor license for the Darwin Rod and Gun Club, resolution authorizing the sponsorship of off-highway vehicle trail funding. That is the consent agenda.
Is any commissioner wish to have anything from the consent agenda moved to the regular agenda? If not, I would entertain a motion to approve the consent agenda.
Mr.
Go ahead.
Chair, I'll approve the consent agenda.
We have a
Second.
motion to approve from Commissioner Schmidt,
I'll second.
second from Commissioner Olberg. Any further discussion?
Yes.
Okay.
I got a question. Where did it go here? Oh, on the Watercraft LLC, is that an AIS? That's
That's-
one of the contracts that you guys normally do.
Well, we replaced this,
It's new.
in the past, it was Waterfront Restorations that did it. And they just thought this year might be a good year to just try something different.
Okay. I was just,
See if the data that they present at the end of the year will be different than the data we were getting from Waterfront. So, more so just a change to try something different.
okay. No,
And it was a hair cheaper too. So,
okay. And then I have another question. And this one is for Barb, possibly. I got a question or a call the other day on pertaining to liquor license. Is there a commissioner, like at the state somewhere, what's that commissioner's title? Like, is it commissioner of, do you know what department?
Well, we're part of the public safety, and it's the alcohol and gambling division. But
Okay.
I can get you the title of who is,
Okay.
who signs and,
And really it was just on storage of, I'm gonna put excess supplies, and the statute says you have to store your liquor, like if you have a liquor store, on site, and they have like basically it's a connecting wall, and they were just concerned, it's another suite in this business, and they wanna put their overflow or excess storage space in there, and they're concerned they might be in violation, so.
I'll
And
get
they-
you the,
Is it in
Okay.
the same building?
Yes, I'm assuming, yes,
I don't,
I know, but they're
I'm
just,
pretty sure there wouldn't be an issue with that. Like,
well, and they reached out
we
to
have
me
ours down
because
on a
of,
different floor. It's kind of the same thing.
yeah, they just said, then they said that unless you have a letter signed by the commissioner,
yeah, I
well, they reached
understand.
out to me, and I said, I don't think I'm the commissioner. I said, I think it's okay.
They want a
but-
different commissioner.
But I said, I think it's, so I wanna get a contact from
but for the first time, I also had an on-site inspection, and they came and also visited with me at the office. So that was really interesting from the AG.
Okay, I'll,
I'll get that to you.
Darwin has a similar, don't they? Don't they have a container that sits behind the Darwin liquor store? That, so it is not physically attached, but it's right there.
Probably shouldn't bring it to anybody's. You didn't hear that, did you, Tom?
There's also a phrase that says premise, and so it's been looked at as premise, so that might be the situation.
they sent me the statute, you know, and what they were referring to, and just, they had questions, and I said, well, I'll do my best.
And I do know that Darwin had to get permission to do that, so.
Yeah. It's good they're paying attention, really.
Yep.
That's good to
Yeah,
know.
yeah, they're,
Do the right things.
So. Any other questions on the consent?
I have one question. I was looking at the grant funding for the OHV. Do we have liability then when we are a part of that, granting approval to enter into that with the state of Minnesota?
Andrew, do you have an answer? Or?
Is that-
It's with the state of Minnesota. If I try to make any changes, they usually send it directly back. And so it's just kind of that cooperative agreement between the state and the county.
Ultimately, all we're doing is passing through the funds.
Pass
Okay.
through.
And so there needs to be a fiscal host with these sorts of things, and the state doesn't want to deal with each of these trail associations across the state, so they go through the counties, and then the county issues the funds.
So if somebody were injured, we're not liable?
We are not,
We don't
no,
have any
no.
liability? Okay.
Similar, it'd be same as snowmobile trails.
Yes,
right?
exactly.
Same
Okay,
concept
great.
or whatever.
Yep.
Good question, though.
Any other questions?
On the lake, pardon me, Mr. Chair, on the Lake Manuelo mini BIF, so who takes care of that then? We're buying it?
Well, once they do the lease, then that lease includes the weekly.
Okay, so
Pumping,
that's piece,
cleaning,
that's all included, okay.
Yeah, and just to clarify, that's partly because of the distance to the restroom.
Right.
You have to walk right through the public beach.
All the way down
leaving-
to the other end.
Yeah,
Yes.
So,
Okay, thank you.
hearing no further questions, we have a motion on the floor with a second. All those in favor say aye.
Aye.
Opposed, same sign.
We need a
Consent-
roll call
the-
because of the resolution, Mr. Chair.
You need a roll call
Need
because
a
of the
roll call
resolution.
because of the resolution.
My bad,
Commissioner
that one more
Oberg,
my bad.
Yes.
Commissioner Oberg,
Yes.
Commissioner Van Ort,
Yes.
Commissioner Schmidt,
Yes,
Commissioner Samke,
Yes.
and Commissioner Johnson.
Yes. Now the motion carries.
It's only your second mistake since you took the chair on camera.
Someone's counting.
Ashley, are you ready for us? Because it's kind of a feisty group this morning.
Well, hi, everybody. I'm Ashley Chosa. I'm the Executive Director at Woodland Centers. If you're not familiar with us, we are the Mental Health Center. We're a private nonprofit agency. We primarily serve 7 counties here doing all mental health and substance use services. I think, do you guys get the packet?
Yeah.
Yeah.
Yes, and they have it in their packets too.
Wonderful. And so this first page just is an overview of really who we are, why we do what we do, just to, again, give you guys an overview. As I said, we are a private nonprofit entity. Our why statement really is why we exist, and we really believe connections transform lives. And so for us, that's about the connection we build with our clients. We know that's about 40% of recovery is people having somebody that they can connect with, that they feel like understands them and they can communicate with. But it's also the connections we have with our community. In Meeker County, we're right here in this building, and so having that connection with social services, having the connections with food shelves, with housing supports, all of those pieces that our clients really, really need to help them live their best lives and reach their goals. So those are the connections we're always working on. And our commitments are on the bottom there. It's really, our biggest commitment is we save lives. That's our goal every day, is to save a life, to help reduce barriers to accessing care, to reduce stigma to accessing care. So those are the things we're working on every day at Woodland Centers. So if we get into the data a little bit, I wanted to share with you who we serve and give you a picture a little bit of our clientele. So in 2024, we served 4,762 clients. 2023 was an anomaly. We served a lot of people, but as you can see, the trajectory back to 2024 is kind of on par. It's still growing over the years, if you take 23 out as an anomaly. But every year we're hoping to just grow and see more people that we serve. I do have on here the clients by county, so you can see who we're serving every year. Last year in Meeker County, we served, it was 13.27% of all people we served were from Meeker County. The non-catchment, those folks are coming from different areas of the state. Maybe they're coming here for crisis. They might be getting other services as well, but it's about 16% of everybody we serve is not from our 7-county catchment region. We served ages 3 to 87, so we do serve the whole age range. And we serve people from 69 of the Minnesota counties. So people do come from all over to see us. And sometimes they're living in our catchment region, but maybe their county of responsibility is another county because they're living in a group home or something. So we do count that as their county of responsibility is another county, even though they're living maybe in Meeker County or in Candy Ojai County, if that makes sense.
Ashley, if I may interrupt you, it shows 5,023. Now, that's not visits, that's individual clients.
Yes, individual
Okay.
clients, yep.
And I know this is probably an impossible question, but I'll ask it anyway. Is there an average number of times you see?
That is really hard. It depends on what service they're getting. Oftentimes, our clients are getting many services from us, so they might be getting therapy, they might get psychiatry. So depending on what service they're getting, so like therapy is usually every other week. And they might see us for 6 months, they might see us for the full year.
Okay.
Psychiatry, every 2 to 3 months. So again, depending on the service, if they're in ARMS, which is like a rehab service, that's usually a weekly service.
Okay.
So it could be a lot, it could be just a few, it just depends on the client need.
In fairness, I did not expect you to have an answer for that question, but I wanted to, I was curious as to,
Absolutely.
yeah.
Yeah. We are also looking at, so office was perfect being here. One of the things we're really focused on as a CCBHC is how can we reach more of our veteran community? Last year, we only served 75 veterans, which is down 6 from the previous year. We know there's a huge need in our communities. And we know that the VA is available for folks, but that's also a ways for people. And so we are part of that community, and I cannot recall the name of it right now, where veterans can come seek us for services instead of the VA and get that permission through the VA. And so we are trying to expand that. We just know there's more need than what we're seeing. So figuring out how to reach that population, how to partner more with our VSO offices across our 7 counties is a big priority for us.
I think we tried to do a group,
Yes.
right, for that.
We had a support group. It was actually started by a veteran, and they just wanted us to be a part of it, just to come and offer support. And so that group still runs, but there's only 2 or 3 veterans that come. It's pretty
Never
small.
seems to catch on, and
Yeah.
we talk a little bit at board about veteran suicide rates being up and how important it is we reach out to veterans, but they're difficult to reach, but I
is.
appreciate that Woodland is trying, so.
Like veterans and farmers, it's the
Yeah, and
populations that are
farmers,
just
we
tough.
talked
It's a
about
tough
that.
population to reach, and just trying to be really strategic about how we partner.
So I got 2 things going on.
I was just gonna say, we gotta,
Oh, I should have put it all in one category.
There's always an anomaly.
That's right.
You calling Steve an anomaly?
No.
The next page, it just again breaks down some of our client services, or the clients that we've served. So you can see the different age ranges and the numbers of folks. That 0 to 5 population, we serve 41 individuals that were 0 to 5. That keeps growing. We're also seeing more youth come in our doors, which is great because we hope to see folks sooner. We know people wait 8 to 10 years from their first symptom to when they actually start seeking services for mental health. We want to have an impact on that because if you wait that long, by the time you see us, you're in such a hard, terrible state that it's really hard to get you back to baseline. If you start to have symptoms and you come see us, it's much easier to get you back to where you were previously functioning. So if we're seeing more youth, our hope is that we can get them better sooner and it's not impacting them the rest of their life. We're still going to have those folks, but the hope is to do more prevention and early intervention work.
Mr. Chair, I have a question. So you said when people come through your doors, my curiosity is always, how do people connect with you? Who sends people to you?
Great question. So always, so a lot of times people are self-referred. They come in because they've heard of us somehow or their family members heard of us. Primary care physicians refer to us. ERs will send folks to us. We're hoping for more law enforcement contact because we know that a lot of people are dialing 911 when they have an emergency. And so how can we get them to either partner with us, law enforcement, to help our mobile team go with them, or refer folks to us. So we do get referrals a lot of different ways. And when I say walk in our door, a lot of people are not actually physically walking in our door anymore. It's a lot of telehealth, a lot of people calling for services, family members calling on behalf of another family member. So we get referrals a lot of different ways.
Okay, thank you.
Yes. I did put on here employment status. We're always looking at how can we help our clients succeed, and we know employment is a really important piece of that. It helps people feel fulfilled, gives them a sense of purpose, helps them with daily schedules, and so we work with an IPS program, individual Placement Supports Program, lots of acronyms. And so it's a program that we work with WCI and the Workforce Center to help place individuals with mental illness into employment situations in the community. And that's part of what we do here in Meeker County. And so it's not for disabled people necessarily. They could be disabled, but it really is competitive employment in the community. And so placing people in those different positions, that's a good fit for them. And so for us, you can see 28% are employed. We have a 21% unemployment rate. We do have people that are retired. We have people that are disabled. And that disability rate, that's going to be folks that probably have that severe mental illness that just are not able to be in the workforce at this time. Sometimes they are working part-time, but still have that disability status. So, and then I do have here on here the race and ethnicity of clients served. When we look at our populations in our community, we know that there are some people of color in our communities, and how can we serve them better? So we have a fairly large Somali population in Wilmer, a fairly large Hispanic population in some of our communities. And we are not seeing as big of numbers come through our doors as we would expect. So again, trying to figure out how to do some outreach, how to help those communities access services in a meaningful way. It's always something we're trying to do more of. So just keeping track of that's important for us. Other stats to note on the next page, most clients are actually living in a private residence. And then this number I think is underreported. 0.67% are reported as homeless. We think that number is actually higher because homelessness, I think how we look at it in rural Minnesota, people are living at other people's homes, they're living on couches, they're living in their car, and they're not always reporting to us that they're homeless. So we do think that number is underreported. The next piece, commercial insurance, was the primary carrier for 18.44% of all services. Medicaid was 61%. This is low for us. Typically, that number is at 70%. We think a lot of that is due to that Medicaid rollback that happened after COVID-19. If you recall, people were automatically kept into MA services. They were not disenrolled because of the pandemic. And so in mid-2023, they started the unwind where people had to re-enroll, resubmit their paperwork. And in the last half of 2024, we saw this number dip from around 70% down to 61. And we think some of that is our clientele don't open their mail. They don't always submit their paperwork on time. It's part of their mental illness. It's part of what gets in their way. And so we're working with folks to try to get people who are still able to be enrolled to get back onto enrollment. And I know social services at every county is working on this too. It's an important piece for all of us.
I think it's caused the issue. I know personally a couple people that just are without meds now because one day they realized they weren't getting help anymore.
Yes.
So, and they don't have the money to do anything about it. And it's we hear about it at Prime West also when we go. You know, they changed how they were going to re-enroll twice or whatever, and so it has created a large mess, and I worry about what's coming down the road because of it.
Yes.
So
I agree.
It's going to be ugly.
We have, go ahead.
So on some of this, if they were, say they were using Medicaid through the COVID process and stuff, is what, and I see you're around about 19% on commercial insurance. Are some of these folks able to use commercial insurance and maybe don't know how to do that as well?
Yes.
Insurance health insurance in general is a confusing animal. I mean, even for somebody who kind of understands it.
No, it is.
Yeah, it is complicated. So some of these folks have shifted over to commercial plans. Some of them have maybe dropped off Medicaid. What we're seeing is a lot of kids too. So it's maybe their parents have commercial insurance, but their kids might still qualify for Medicaid because it's a different formula, is my understanding of how kids qualify. But yes, some of them are definitely on commercial plans. We do have sliding fee scale for all of our clients. So if you qualify for that, it's based off of your income, number of dependents, and then we can, every year people have to renew that. So we did see a lot more people coming onto our sliding fee scale, which is challenging for us because there's only so many dollars in that bucket, and we definitely overextended that last year. And I had another thought and I lost it. So
I think we've talked about hiring navigators to try to help people get Because for some of them with mental health issues, everything is such a process, and if they, like CCBHC helps them, they need help to know when they have to reorder their meds, which is not easy, because then you might have to do a doctor visit, or,
That's right.
the whole thing is a lot of statutes and laws that could easily, in my opinion, change to make life easier. Am I saying that?
You are absolutely correct.
And
you reminded
instead,
me-
they keep making it more difficult.
Yes. And you reminded me of what I was going to say. We have sliding fee scale, but when these folks fall off of Medicaid or maybe are uninsured, it's a small percentage, but when they're uninsured, they can't get their medication.
Right.
They can't go see their primary care physician like they used to without getting a bill. And
Yep.
so not everybody has sliding fee scale. So they might be able to get services from us, but that's not everything that they need. And so helping these folks get back on Medicaid is super important. We're partnering with Legal Aid and UCAP, who have those navigators in place, who've done this work. And so we have some direct contacts to do those warm handoffs to be able to get them the application filled out, help them get then to social services who can process those applications. So we're hoping that we can start to see an increase in the number of people that are qualified for Medicaid, able to access their services. I mean, it's one of those pieces where it's that connection, right? If people are not taking care of their physical health, they don't have anywhere to live, we're not going to be able to make a big impact on their mental health care because they need all of those things in place. So it's really important to make sure people have good health care. And it's complicated, you're right? Like all of these systems are complicated. Health insurance is complicated. So hoping to navigate that with them.
And they may end up in an ER then, so they
Yes.
just go to the ER, which we have to take, and then they can't pay for it. It's just, it's such a vicious cycle, and I can see some easy changes that could make it so much easier, but nobody's willing to do that, and I don't understand that. It's difficult, so. Anyway.
The next chart there shows modality of services. I think this is important to see how things have shifted for us over time. Of course, prior to COVID, almost everything was face-to-face, and as we've entered into COVID and then slowly moved our way out, we can see more things shifting to face-to-face, back to face-to-face services, less telehealth. Telephone is almost entirely obsolete, but we do still do some phone calls. Sometimes our clients forget they had an appointment and our providers will call them and they're like, oh, I can't do a Zoom right now. Great, let's just do this over the phone and just connect at least so that we can at least see how you're doing and check in. One of the things that I looked at was we do have some outliers. So adult day treatment, outpatient therapy, and our med management, a lot of those services are happening over telehealth. So when you take those services out, 91.18% of the rest of the services at Woodland Centers are happening face-to-face. So I wanted to just show you some of those outliers because those services are happening a lot telehealth. A lot of our providers are telehealth. A lot of our clients prefer telehealth. You can go take your lunch break and do your therapy session and not have to take time off. Psychiatry, the same way. A lot of telehealth providers are happening over psychiatry. And so I think people have just become accustomed to that. And it's been helpful for people to access those services.
I think it's, some people prefer, some people have transportation issues, which we've talked about, so this has made that easier, so there's some great parts to.
Yeah, sometimes it's just more comfortable to be in your own
There you
space.
go, that.
Absolutely, absolutely. And a lot of our other services are out in the community. So for like our armed services, rehab services, we're going into people's homes, we're going into the community, and so it just makes sense those are face-to-face. So it just depends on the service, but you can see a lot of things are happening through that modality. The next pieces are about our urgent care and mobile crisis. So urgent care was a brand new service for us. It started about 2 years ago. It's really a build off of our mobile crisis team. So we had a place for people to come. We had our residential crisis units for kids and adults. We're one of 2 in the entire state for youth crisis. And then we had a place where we could come to you. We had mobile crisis, and we could go anywhere in our communities 24 hours a day, 7 days a week. But we had people saying, I don't want to come into crisis because I don't want to be locked up. I don't want to have to stay. And then we had people saying, and I don't really want you to come into my house. So we're like, okay, let's find a middle ground. And that was urgent care. People know what urgent care is. You come in, you have an issue, you get seen, you go home. And so people really like this model of care. We have law enforcement that drop people off. It's available in any of our clinics from 8 to 4 when we're open. And we can see over time just the number of services increasing every year that we've been doing this. So last year, we did 704 services through urgent care. Assessments, again, just as a reminder, this is when somebody comes in for the first time. We do a quick assessment. A practitioner and a professional meet with that individual and just figure out what's going on. What's the crisis going on today? We don't go way back in history. We really want to figure out what's happening today, what's going on for you, and then we make recommendations and referrals for ongoing services. A lot of times that results in stabilization, which is from today, from the assessment to when we can get your therapy or med management services going. Let's do some stabilization in between where our mobile team meets with folks and tries to just help with whatever the crisis situation was to help stabilize that person in between. And a lot with the mobile crisis down here, that's a lot of those same services. Oftentimes with them, we're going out in the communities, folks, and doing those services or going along with law enforcement. Wherever the individual needs us is where our mobile team will go. So that's those numbers down there as well. You can see, again, those numbers continue to increase, which is what we want. We want to be able to take those calls before law enforcement has to go out, before somebody goes to the ER. We want them to call us. So that's been our goal.
This is another service I remember since I'm the seasoned commissioner in Woodland for all these years. When they started mobile crisis, we got a lot of money. I remember it was like, I don't remember the figure, but it seemed like a lot. And our staff from Woodland volunteered to be on call, and it really took off, and it's really a success. So what's happening with the funding?
Right now, we have funding for the next 2 years. With the governor's budget, there is kind of a cliff where we're going to lose about $8 million in this program across the state unless they put in more funding. So I know teams are already struggling with the amount of money that they have because the costs continue to, of course, rise because you have to pay people to be on call 24/7. Even if nobody's calling, we still have to have people available. And so it is a challenge, and it's so important. It's such an important service.
I hear success stories from people in the community.
That's
But in the end, there again, it's gonna save you some money because you're not taking them to the, but as usual, I'm just gonna say, the state of Minnesota is gonna take away something that works again, in my mind.
Hopefully not.
Well,
Hopefully not, I agree, but I just putting it out there so people know that this is what you're facing.
Yep, absolutely.
Programs that are, they work.
Mr. Chair, if I may, the mobile crisis, that increased demand is probably tied directly to the lack of like the drop in numbers, people that are not coming. You know, these people you want to see long before it's a mobile crisis situation.
Yes,
So what I'm getting at is the other numbers that we're seeing that have a decrease, and then there's probably a direct correlation between the decrease on one hand and the increase on the other.
Yes. And the
But I
whole-
think mostly they direct them to come in for help where they need to, right?
Yes.
When they go to,
Yeah.
they might decide you need to, I think she should go to crisis for 72, right?
But
So
if you're-
that's part of it.
But
Yes.
if you.
I see
let
what you're
it-
saying.
If you've let
Yep.
it go and not addressed the issue earlier on, and then it ends up,
That's true, probably.
That's correct.
Yeah, I see what
Yeah.
you're saying.
you know, I mean,
It can,
it keeps,
absolutely.
you should have addressed it somewhere, family, or somebody should have
Probably.
guided you.
Yeah,
But if
maybe.
you're not reaching out.
I feel like it's a lot of young people, isn't it? Teens.
There are a lot of kids. I mean, we get mobile calls for everything. So
Right.
sometimes it's parents saying, I can't get Johnny to school today. He
Yep.
won't get out of bed, or my child ran away, or I'm really anxious, or I'm suicidal. And I think part of the message we're trying to get to all of our community partners and to our clients is you define the crisis. Don't wait until it's to this escalated level.
That's-
It's not just for suicide. It's not just when you're at this level of I don't know what to do anymore. Call us sooner. Call us when you're like, I'm just not feeling right and I don't feel like going to work today. Okay, we can handle that. That's our bread and butter. We do really good work there. We do really good work when somebody's suicidal too, but we want to intervene sooner so that you can get to work tomorrow, not skip work for a week and then call us. So that's been something we're trying to push to of how do we get there sooner.
Ounce of prevention equals a pound of cure type thing.
I think there's still a stigma about mental health. I can remember Al Gore's wife talking about it. So, and still, I still think there's a stigma.
Yes, very much, very much. There's a lot of fear
Sadly.
and
Yeah.
worry from people. Yeah. And trying to ease that, it's just an ongoing process. We've made a lot of inroads. I think you know, when you have Simone Biles at a national level talking about how
Right.
mental illness impacts her, like that's a big deal. And people can see themselves in her, and it helps, but we're not there yet. We still have a ways to go.
Certainly better than it was, that's for sure.
Absolutely, absolutely. I did put in some staff data here, just so you can see kind of over the years, over the last couple of years, where we've been. We continue to grow in our number of staff as the needs arise. So we have retention rates of 95% in 2024. People are staying with us, and our turnover rate is down. So this is one thing that we're focusing on as a leadership team, is how do we create a culture at Woodland Centers where people want to come here and they want to stay here. It's been a really important piece for us because this is hard work. It's really hard work to come here every day and help save lives, and it's impactful to our clients and to our staff. And so we really focus on self-care for our staff and helping them just stay here and be here.
Well, congratulations on that number. That was the happy news I saw on this report. So
Yes, it's been definitely a work in progress. We had our Meeker office remodel finished. That was very exciting. It's a beautiful space. We also are in the middle, well, we're finished with the remodel. We are getting our license. Actually, the DHS is coming today to virtually walk through our crisis units so we can hopefully open up more beds. We did a remodel when we closed detox. We moved our adult unit over to our old detox unit, and it should expand our unit by 3 adult beds and our youth unit by 1 bed. But we had to get all the approvals in place, and it's taken more months than we had anticipated. So hopefully we get the A-OK today and we can get those beds open, because there's definitely a need. We've been rolling out a measurement-based care platform. So what this is really our ability to take real-time data. So all of you been to the doctor, you filled out that 9-point questionnaire of, have you been feeling sad? Have you been feeling lonely? Have you been sleeping well? That's the PHQ-9. We do the same assessment plus whole bunch more, and we're having our staff use that real-time in session with our clients to say, how are you doing? Because sometimes they don't always report what they share on the paper, and so we can use that information to really guide our treatment and guide what we're doing. And so that's measurement-based care. We also implemented Elios, so it's an AI technology, sits in the background. This is part of our staff retention model, sits in the background of our sessions and helps people with documentation. People hate documentation. I don't care what field you're in. You don't go into this work because you love paperwork. You go into it because you care about people. And so this technology for therapy, for example, typically notes take about 15 minutes per session. With using this AI technology, we got that down to about 3 minutes. So it saves a lot of time, and the notes are beautiful. They're beautifully written. Staff have to, of course, look at them and edit them, but it takes them so much less time.
More
So,
time with the
beautiful.
client.
We're also right now in the middle of pulling all of our data together. We get data from so many places, from our electronic health record, from DHS, from all these different systems. And so pulling that together into what we're calling a FIA data analytics system so that we can use that in a more meaningful way. So when we submit reports to you all for our purchase of service contract, hopefully that will be a little bit easier to read and we can pull that data a little quicker. So just trying to be more efficient with our time. We're also doing substance use assessments across all of our jails, and this is billable through the behavioral health. I lost the word, but there is a fund, behavioral health fund, there we go. And so we can bill those services through that fund when we're in the jail. So there's no contract needed, but it's been really effective because we can go in, do that assessment, give the recommendations, and most of the time we can help find a placement. So when that person leaves jail, they're going right to treatment. We know that recidivism rate, if they go home in between there, it's pretty poor. So if we can get them right into treatment, there's less chance of them relapsing.
We do Mr. Chair, when we do a substance abuse assessment in jail, is it recommended by court or?
Sometimes it is. Sometimes, I would say most of the time it's probably recommended through the court system. Sometimes people are asking for it because they know it might come. So it just depends on, Yep.
Thank you.
We also started a partnership with the West Central SWAT team. This is our first partnership like this. We know that SWAT calls often have mental health and substance use issues involved, and so we have 3 clinicians, I'm going to be one of them, that's going to get trained with this SWAT team and then go out when there's a call and be part of the negotiation team in the background. So we're pretty excited about that, to just be able to have an impact on some of those calls. And then we placed a mobile crisis staff member in with Candiota County Dispatch. It's 8 hours a week right now. This is really a pilot system. What we're hoping for, again, is that intervention piece. A lot of people call 911 when they have a problem instead of calling our mobile team. So if we could take those calls from 911 instead of having to dispatch law enforcement or dispatch with law enforcement, we might be able to intercede quicker. So we just started this program in December, really just a pilot to see how it's working. But so far it's been pretty successful. And I think just building that relationship has been really important. So this year, focusing on stabilizing operations, really just all the things we rolled out last year, trying to just make them work well and develop a comprehensive three-year strategic plan. Of course, looking at state and national legislative things that are happening and how that may impact us. At this point, a lot of unknowns, of course, as everybody's kind of watching and waiting. We just don't know what's going to happen. So just watching at this point, and just looking at quality improvement. How can we do more care, better quality of care, and help people get better faster is our goal. So any other questions you have for me about mental health, about Woodland Centers, I'm happy to answer.
You had a very nice article in the West Central Daily Tribune. I had a couple things highlighted in there. I was going to ask you from the article, but I think you answered them already, so.
Yeah, and that was from my report at the Renville County board meeting, so.
She didn't ask for that article.
Yeah, I did.
Well, but it was a good article.
Yes,
And it,
yes.
you know, was a nice prelude to today, so. Steve, did you have a question?
Go ahead.
Thank you, Mr. Chair. You mentioned beds and increase, where are the beds located?
So in Wilmer, we have our adult and youth crisis units right in our location there in Wilmer. They're in the same office building.
Okay, and you're gonna increase, how many, what are your total capacity you're increasing with?
Now, I think we have I want to say 11. I think we have 6 adults and 5 youth, and so we'll move up to 9 adult and 6 youth, I think is where we're
Okay.
gonna be.
So 15. Okay,
We closed the detox and did a remodel, because detox just wasn't, nobody comes to detox anymore, so.
So if you have a need and your beds are all full, where do you end up?
Oftentimes, we put people on a wait list, and they might be in the ER, unfortunately, because we are a short-term residential crisis, so typically it's 3 to 5 days. We're dealing with a crisis situation, and then we're referring for ongoing services. Sometimes people do stay with us for a longer period of time if they're waiting for a higher level of care, so we do take people on commitments, so they can stay with us for a few months while they're waiting for maybe an IRT level of care or a CBHH, a state level of care, but that's really working with the counties if they have that need.
Aaron, did you have a question?
Yeah, I did. I have to admit, I know virtually nothing about Woodlands. I mean,
For
just,
that, Mr. Commissioner.
but so my question is like, so how many facilities are there? I mean, and I'm seeing all the different counties that are utilizing the services, and so that's, I guess, I'm just kind of
Yeah,
wondering.
generally Woodland Centers, absolutely. So historically, we've been around since 1958. We're one of the oldest mental health centers in the state of Minnesota. We have one office location in each of our 7 counties. And then depending on the size of that county, oftentimes we're open 5 days a week in those clinics. A couple of them are only open like 2 or 3 days because they're smaller clinics and just don't have that need yet. And we have about, want to say right now, about 225 staff at various levels. So we have folks that are entry level. We call a lot of them peer supports. They maybe have lived experience. They're not licensed, but they have that experience and can walk alongside somebody. And then we have people all the way up with like an MD working in prescribing medication and everything in between. So we have a lot of different ranges of staff providing different levels of care.
Gotcha.
Yeah.
Nice.
We have about 26 different programs and services for people to enter. I think a lot of times people feel like we're just therapy and psychiatry or just meds. We do so much more than that. And we're trying to help people understand that there's so many different levels of care that we can provide people. Yeah.
Thank you.
Yeah.
Are you, a little later on in our agenda, we'll be looking to approve a letter of support for Clay County in that remodel. Are you aware of that and what they're trying to do?
No.
Okay. That may be something you want to just take a look at. It's a remodel of a West Central Regional Juvenile Center into an 18-bed psychiatric residential treatment facility. So just something might,
For juveniles.
Yeah, there's more need for that, absolutely. It's, there's only a few in the state. PRTF levels of care. It is a high need. We need so much more for youth. It's impossible to place youth in different areas, and there's so much need. So anything we can do to help support our youth in this state would be very beneficial.
Any other questions for Ashley?
I'm just gonna put out there for the budget committee, I think budgeting is gonna be a struggle this year. You can see why with Ashley's report, so it'll be coming down, I have no idea on a number, but it'll be coming down the road. I'm just addressing the budget committee here, so they got time to think about it.
Yes, yeah.
Get in line.
I know.
You did note that you have funding for the next 2 years.
No, just for
For
one.
mobile
vote.
crisis.
For mobile
Just
crisis.
So that's a
Okay,
grant,
thanks for that
yeah.
clarification.
So we get grants for mobile crisis to help cover the uncompensated care. And then we also get that for our schooling mental health. So we're in 15 different school districts providing services. And so we get grant funding to help cover education for the teachers, working with students who maybe don't have any other form of income. So we have those 2 pretty large grants that are 2 to 4 year grant cycles, depending on which one it is. But then everything else we do is fee for service. And so it is really billing out and getting money back. And then we do have our purchase of service contracts that we do with each of the counties. It's one contract that we do for all 7 counties, and we renew that annually with all the counties.
That's what you'll
Thank
be
you.
budgeting. You do, thank you, Ashley.
Yes.
You do a good job over there.
Thank you all for your support. And if you ever have any questions, I'm happy to be a resource on anything mental health, substance use related. Please don't hesitate to reach out.
Maybe someday after a board meeting, we'd like to just see the remodel that you did here. If one of your staff,
Yeah,
sometime if we wandered down there.
yeah.
Might be interesting just to see.
Absolutely, yeah.
Do they
if you
like the
guys-
remodel?
Yes, they love it. They love it. It really helps. So we had one huge room that was
Right.
used for schooling, and we were able to separate that into smaller offices and still have a group room. And so it's utilizing the space more effectively was really important piece for us.
I think it's so nice that we have that office in our building. It fits with everything we have in here, and it has for a
Absolutely.
long time, so.
Yeah, anytime you guys want to walk through there, just let me know, and we can make sure that our staff are kind of prepared and the clients
Good.
kind of know. And yeah,
Great.
absolutely.
Perfect,
Yeah.
thank you.
All right, thank you so much.
Thank you.
Thank you, Ashley. Public Works Director, Phil, we usually take a break before we have, we won't do that today, no. But it does always kind of seem like whenever you're about to come on, we
Right.
have a need for a short break. But
Worried I'm gonna talk a lot. Good morning, Phil Schmaltz, Public Works Director. 3 items for consideration this morning. The first one is to consider an advanced construction agreement with MnDOT for the CSAT 3 project. So you've heard me talk about CSAT 3 quite a bit. We've got a little over $3 million in federal funding to help on the $4 million project this summer. Typically, we have a standing master agreement with MnDOT to handle our federal funds. On this one, because of the advanced construction piece, we need a specific agreement to the project. All the advanced construction means is that a portion of the funds is not available until fiscal year 2026, and it's a small portion, it's about $55,000. And October 1st is when 26 fiscal year starts for, I think that's the federal government. So that's the need for the agreement.
questions for clarification?
Mr. Chair, I'll move to approve an advanced construction funding agreement number 1059158 and associated resolution with MnDOT for SP 04760301.
Motion to approve by Commissioner Schmidt. Is there a second?
I'll second that.
Second by Commissioner Van Ort. Is there any discussion?
Mr. Chair, if I may.
Yep.
Phil, do we have a start date on this project, kinda? Target?
Yes, it's being advertised right now. I gotta get you the date. So we're planning on doing our 12 on the south part of the county first, so I'm thinking this is after July 4th, if I remember
Oh,
right.
okay,
But I can get you the exact dates in the contract.
okay.
I just don't have them with me.
Like, we approved the culvert replacements here a few weeks ago, or a month ago or so.
Yep.
Are they gonna be done?
They're supposed to be done before the end of May.
Oh, okay, all right,
They can start soon, once restrictions come off, maybe.
sure.
Yeah.
Okay.
I just want them out of the way.
That's what we're just for emergency services in the township. We like to know when we're gonna have pipe out of the road.
Yep,
so.
we don't have a start date for it yet, but we'll get it out to emergency services once we have a date.
Okay, all right, thank you.
Any other questions or discussion items? Hearing none, we have a motion and a second. We'll call for the vote. However, this is a resolution.
Commissioner Schmidt,
Yes,
Commissioner Samke,
Yes.
Commissioner Olberg,
Yes,
Commissioner Van Ort,
Yes.
Commissioner Johnson.
Yes. Motion carries.
Thank you. Second item is to consider the approval to purchase Step Manufacturing 5.0 patch wagon. So we have one patch wagon we use for patching asphalt pavement when needed. It's pretty important to our operation because when it doesn't work, we've got to find something for the crew to do while we're getting things fixed. And it's become unreliable in the last few years, so we'd like to replace it. A 5 cubic yard unit, which this is not widely available, so that's why we opted to go with the Step Manufacturing unit. The price is off the state bid, but as with a lot of equipment purchasing lately, the price we're committing to is not necessarily the price we're gonna get it built for. That's why you'll see our estimate is about $156,000 for the equipment, but I'm looking for a not to exceed price of $170,000 to give us room to not revisit the topic if the final price comes in over what we get approved here today, or what the estimate is today.
Phil, didn't we talk about a patch wagon a year or two ago? Or was that a different piece of
It's been
equipment?
in the capital budget, 3-year budget that we look at when we're talking about budgets. But I think it's always been for this year.
Okay.
I'm trying to remember in budget, I don't think we moved it, did we?
No.
I don't recall it. Not that I would.
I remember discussing that was all.
Yeah, it's been in
Yeah.
budget numbers but future, but I don't think we've moved it.
The future is here.
Exactly, yes.
Mr. Chair, I move to approve the purchase of STPH 5.0 patch wagon from Step Manufacturing of North Branch, Minnesota for a not-to-exceed price of $170,000.
Motion by Commissioner Olberg to approve. Is there a second?
Second.
Second by Commissioner Samke. Discussion. Hearing none. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries.
Thank you. Final item, another equipment purchase topic. So in this instance, we had truck purchases with a not to exceed price that we did exceed when the actual number came in upon delivery. So we had 2 trucks approved in September 3rd of 2024 by the county board. We had a not to exceed price on that of $330,000. The actual price now that they're ready to be delivered to Towmaster for outfitting is $331,976, so about $2,000 over the price we had initially set for not to exceed. Like you've seen in the past, like I said, equipment is a bit of a difficult game these days. We order it, and then the state contract shakes out after the order's placed, and then we find out what the number is when it's built. So it's unfortunate. We do have funds in the budget to cover that. We budgeted for $710,000. We're looking at about a $700,000 purchase when we're done here, after we factor in the 2 trucks and the snow and ice equipment that goes on them. We've been informed that the snow and ice equipment price is still good from what we had approved back in September.
Mr. Chair?
Yep.
Make a motion to approve the purchase of 2 Western Star 47X plow trucks from Boyer Trucks of Lauderdale, Minnesota for a revised estimate total cost of $331,976.
Motion to approve by Commissioner Van Ort. Is there a second?
I'll second, Mr. Chair.
Second by Commissioner Schmidt. Discussion.
One of these trucks, I know we moved in the budget a year once, if not twice, so I know.
Yeah, one of them dropped off. These 2 are actually, one is scheduled, the other one's in place of a blade. The one that we deferred, we ended up not asking for that one again. So
Okay.
that's what these 2 trucks are.
Okay.
Phil, of our fleet, how many are Western Star or Mac, or is it quite diverse, or?
Exact number I couldn't tell you, but Western Star and Mac is what we're down to, with the exception of, I think we've got one international or Sterling left. Our goal is, we don't want all of one, but we like being a little bit not too diverse that we can have equipment or parts on hand.
Yeah.
So Western Star, Mac, I'd say we're at probably close to 50-50 right now. We were heavier on the Mac years ago, but Mac had a real difficulty producing equipment for us. They were over a 2-year backlog at one point. So we've been purchasing Western Stars now for the last few years. My hope is maybe we get a little more balance here in the future, because I don't want all Western Star equipment. The guys like them, but I think it's good to have it, two different machines out there.
So, question, this is, of course, is being purchased in Lauderdale. If it needs a repair that's beyond the capabilities of our service department, where do they end up going?
We do work with Boyer frequently.
Okay.
So we'll haul it there, or they'll send a technician out to our place if it's beyond what our mechanics can handle.
Okay.
Mr. Chair?
Yep.
Oh, what kind of a price increase are you seeing year over year on these?
What we were seeing the last few years was about 1.5% on the trucks.
Okay.
But if you look here, we did a not to exceed of 7%, and this came in, I think, a little over 8.5% 1 year. That's 1 year contract negotiation plus a 1 year model increase. So sometimes you could look at it as two different pieces. You could have a contract that has a 25 and a 26 model year in it. And then you could have two different contracts on that same 25 model year or 25 model year, if that makes sense. So we're kind of looking at a model year increase and a contract year increase.
Okay.
But yeah, 1.5 is what we've been seeing. So I was a little surprised when we had this big of an increase.
Is there any further questions? We have a motion and a second on the floor. I will call the question. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries.
Thank you. I should clarify one thing. I was thinking about that 1.5%. I think our actual cost has been increasing more than that. That's what the manufacturer estimated for this unit, with 1.5%.
And it came in at 7%?
Yes, over 7.
Do you,
Because it's been more than 1.5.
I was thinking.
when we order a truck, there's no way that there's no cap on what the actual price can be?
With the manufacturer?
Correct.
No, we can cancel the order,
But you, okay,
but that's the price through the state contract they negotiated.
okay.
So yeah, at this point, that would be our option. If we wanted to cancel, we could. Someone else takes our trucks.
And then you pay an additional increase in price the next,
Most likely, I
Sure.
don't know if they'll go down.
And you go back in queue.
Yes.
yeah.
That's the tricky part.
And
All
the
right.
queue wasn't very friendly for quite a year.
No, this wasn't terrible. We ordered in
Yeah.
September.
Yeah.
So this is getting better.
Yeah. But we went through COVID, it got really wide. You didn't know when you were
Years.
getting anything,
Right,
so.
right.
So, yeah, just wanted to
Thank you.
clarify that.
Yep.
Thank you, Phil. Next up is Greg Schultz, and I'm going to use chair privilege and I need to get a glass of water, so we're gonna take just a very brief break while I go fill a cup of water, or whatever you guys need, so. I thought I was gonna die, I was drying
I hear
out.
you, yes.
Are we good to continue? Okay. Next up is Greg Schultz. He's going to give us an annual report from the land use. And thank you, Greg. And I want to remind you to speak loud for those of us who,
It's talking about me for sure.
All right, morning, Greg Schultz, Land Use Director. This is the first annual Land Use Department overhead report. So I'm gonna start out with talking about the Land Use Department overview. By starting with, kind of describing the following departments within the land use group. We have the Planning and Zoning Department, Building Department, Septic Department, GIS Department, Landfill Solid Waste Department, and the Aquatic AIS Species Department. Planning and Zoning Department's main task for the county is to implement zoning ordinances or land use rules for the county. The department is also staffed by Monica Ancrum and part-time employee Paul Holmgren. He's our enforcement officer. Zoning refers to municipal or local regulations that dictate how real property can and cannot be used in certain geographic areas. A little bit of history of zoning dating from the 20th century, around 1950 in New York City. Current zoning ordinance for Meeker County was adopted in 1992. Zoning includes both written regulations and maps showing a different zoning classification in the county. Minnesota state law allows counties such as Meeker to have zoning ordinances and sets parameters for local regulations. The authority to make zoning decisions is divided in Meeker County by the County Board of Commissioners, the Board of Adjustments, and the Planning Commission, and the zoning administrator. Land Use Authority, let's continue here. The County Board of Commissioners and 5-member board whose role is zoning is to review and adopt zoning ordinances and map amendments by ruling and making final decisions based on the Planning Commission recommendations. The Board of Adjustments is a 3-member board with 1 alternate member. And they're all appointed by the county board, and they make decisions on issuance of zoning variances from the ordinance and review appeals from county officials, the county boards, and the interpretation and enforcement of ordinance. Decisions from the Board of Adjustments are final and do not need to go before the county commissioners for approval. Planning Commission is made up of a 7-member voting board appointed by the county board. Planning Commission advises the county board on planning issues. They hold public hearings and make recommendations on conditional use permits, interim use permits, rezoning, and plats, as well as recommend ordinance and comprehensive land use plan changes. Recommendations of the PC board then go before the county commissioners for final decision. And the zoning administrator, the last piece, is the county staff person responsible for interpreting and enforcing the zoning code, as well as bringing applications and information to various boards for their review. There's different zoning districts within our county. We're made up of the A1 Agricultural Preservation District. And that district's primary purpose of the district is to maintain, conserve, and enhance agricultural land which has been historically been tilled. There's an R1 zone district called Suburban Residential District. This is for smaller lot plats generally. It's allowing low-density residential development as an orderly expansion of existing urban residential development, where urban services can be readily extended and provided. There's an R2 rural residential district, generally for larger lot plats, allowing for large lot residential development and utilities where urban services cannot be economically extended. There's a C1 commercial district. That's where commercial needs, not predominantly retail, movie theaters, vet clinics, equipment, rental, sales, and service type of facilities. They accommodate certain commercial activities not compatible with predominantly retail uses for urban areas and grouping together those uses which require accessibility to roadways. There's also a C2 neighborhood commercial district, which is a multi-purpose district allowing retail and general commercial uses in existing small unincorporated urban communities. And the last zoning district we have is the industrial general industry district, and this allows limited industrial adjacent to existing urban areas or on major transportation routes. On the map here, this is a GIS map. We have different zoning districts. If you've ever been on Beacon and clicked on a different zoning district, this is how it would look. Where Walmart is, that's actually the city of Litchfield's boundary. And then above that is R1 residential district. The green area around us would be ag land. The blue area would be commercial land, and that's that truck site that's east of Litchfield, that services trucks and sells trucks, and then the yellow would be the industrial site there on the other side of that, which would be the junkyard. That's kind of how it's mapped out on mapping. The GIS personnel does that throughout the county for different districts.
Salvage yard.
Salvage.
So, Mr. Chair,
Yes.
when Walmart came in, was that a city or did the county, where they, do you know, I wasn't here.
It's in city limits now. I'm not sure.
It
what
is in the
first
city limits now?
It is now, yes.
So they must have annexed it.
That's what I'm wondering
I
because,
believe they annexed it, bringing the city sewer and water out that far.
so we didn't have anything to do with it probably. I wasn't here, so I don't know.
Not that I'm aware of. I haven't seen any records on it.
So if they were to do that service road all the way across, that would be city too then, or?
Correct.
Which would be nice if they.
Remind me, who was first? Was it our new highway building or Walmart out there?
The highway building was there before Walmart.
Was it? Okay.
State.
A little more zoning districts continued here. As well as the 6 zoning districts, there are also a couple overlay districts, and those overlay districts such as like the shoreline overlay district, that's like the 1,000-foot boundary around lakes, the 300-foot boundary around rivers, that there's certain zoning rules and regulations around that. There's an urban expansion overlay district, and there's a wild and scenic river district, which is around the North Fork of the Crow River, and that's 300 feet around the river, but it also has other enhancements through state statutes that we can and cannot do within that 300-foot boundary of the Crow River due to its scenic district. And we have watershed districts such as the Mississippi, Crow, and the Clearwater watershed districts. So that's some of the other examples of that. So rules for districts to allow a residence on a property include plating within the R1 and R2 districts, building eligibility requirements within the A1 district, and property splits and combinations, which could be in any district, whether it be residential, ag, commercial, or industry. They all have the capacity of being split or combined with other properties as long as they meet the minimum size requirements. So, and districts also have specific land uses that can be permitted or allowed by conditional use permit, interim use permits, or allowed with the granting of a variance within a district. Zoning can be utilized to address and control the health, safety, and public welfare matters related to land use. Examples of this type of would be regulations that would be such as feedlots, gravel pits, hot mix plants, campgrounds, wind and solar energy, landscaping projects, agriculture construction projects, and various businesses. Planning and zoning through the Planning Commission and Board of Adjustments issues on average about 36 land use permits, 21 variances, 29 IUPs and CUPs, 6 rezones, and 4 plats a year. It's taken over about the past 5 years at averages. My next will be the individual, my department of the Building Services Department. This department is currently staffed by Brian Fehrenbach. He's our current Meeker County Building Inspector, and Monica Ankrum. She sets up inspections and takes fees and does permits. Meeker County entered into an agreement with the state of Minnesota and adopted the building code way back in 2002. By the county agreeing to adopt the state building code in 2002, the county takes on the responsibility to enforce building code rules for construction projects that need to meet building code requirements. It's done by verifying setbacks and property lines, verifying plans to make sure on paper construction is acceptable to code before construction starts, and investigates building code violations, performs on-site plan reviews, conducts construction inspections for proper building techniques and structural integrity, inspects buildings to be moved, issues building permits, issues citations and correction orders for those buildings. All of this is done to ensure compliance with the acceptable building code and zoning ordinance we have in place, so.
Greg, if I may, we adopted the state building code. Is that the same code that the counties surrounding us are using, or it is?
I don't know anybody has any different, it's all state building code.
Okay.
From what I understand.
Okay. No, I was just curious.
Like, City of Eden Valley a couple of years ago was looking at adopting the state building code, just because without it, there's such a gap. You know, I mean, people do a lot of things they shouldn't. I mean, for lack of a better term, and they didn't get it done. It got voted down. So a lot of small communities don't have state building codes, but the city does. Litchfield,
Litchfield does, yep.
you know, larger communities do.
I just had
Pretty common.
an individual who was not very happy last year come complaining about our building code. Why is it different than the county next year? And I said, I don't think it is. It seemed odd, you know, that it would be anything different than what we are. I said, I'm building all over the state and I've never seen codes like you guys have. And
I've
I'm
heard
like,
that too, but.
Well, not every county has adopted the building code. There's many counties that don't adopt the building code.
Okay.
They just let build whatever, it's whatever the local jurisdiction is, whatever the building permit. Some of them just issued general building permits without any inspections at all.
oh,
Really?
There's many counties that are that way.
So, based on this map from the state, back in 2019, 21 counties across the state had adopted the building code. So that means that the other 66 had not. Of our neighbors, Candy, Ojai, and Wright have. Stearns, McLeod, and Renville have not.
because he's
Looking at the map, it's, you know, if you look at the metro and then it's kind of a spider web out from there, those are the counties that have adopted it around that. Most of greater Minnesota is not.
So they don't have to get a permit for anything?
They may have to get a building permit, as Greg mentioned, but
But
they
may
may
not
not
have
be
to be
inspected.
That would be for the building. There are certain aspects of that,
Yes.
such as the
Yes.
septic system and the electrical system.
Yes.
There are state requirements that you do get those
But not
inspected.
everything is.
Not everything.
Correct.
But I would think that would have,
Then I've had the opposite
Impact.
argument, Paul, that Meeker is way easier than Stearns
Really?
to build in a lot of ways, so.
That's interesting.
So they don't have adopted the code, but their rules are much more stringent.
it's
So
gonna
I've-
depend on the enforcement as well.
Yeah,
So if you're building a house in Litchfield, you go to Litchfield for the building permit, right?
Yes, Jim too inspects that. He's a
And
building
then,
inspector.
we're no part of that at all.
Nope.
And, okay, and the Board of Adjustments, if you go to them and they say and they turn you down, you're done. You don't have an appeal process, or you do.
That's a variance. The Board of Adjustments would be a variance, if they want to be a variance.
That's okay for a variance. That's what I mean.
Setbacks and actual, where they're gonna place the structure on the land.
So if they say, no, you can't do that,
You can come back with a different alternative, but it can't be the same.
Or they
It
can,
has to be 6 months.
or they can appeal to district court.
Yeah.
And we had an appeal relatively recently that went forward and the Board of Adjustments was upheld in that appeal.
okay. So, but that doesn't ever come here to this board.
And that makes sense now
Confused about
because
that.
this builder does a lot of work in McLeod.
There you go.
And that was one of the issues, was the size of the footing he had to put in. He said, that's ridiculous. He said, well, you know, it's our code.
I've
That's
gotten
what it is.
complaints that
It's a
they've
build-
said you
you know, if
can't
the
go to
permit says that,
Menards and
that's
buy
it.
your lumber. We had an inspector doing, I don't know how you can tell people where they can buy their lumber. I have had those kind of complaints, so.
and just to be clear, like, county has no jurisdiction in the city of Eden Valley or city of Watkins either, correct?
We have an accessibility agreement with them that they've signed with us, unlike handicap accessible buildings and things
Okay.
like that. We inspect that for Eden Valley and Watkins,
Okay,
yes. For the cities of Dassel, Grove City, and Cosmos, we actually have.
We inspect
with
for
us
them.
To enforce the building code for them.
okay,
So
Well,
they
Eden-
take permits and send them to us for our building inspector to go over and
Okay.
inspect projects in those cities.
Well, Eden Valley's got a unique issue anyway, don't they, depending on which side of the street you're building on, or?
yeah, yeah,
Would
exactly.
really be something, wouldn't it?
Used to be
Oh.
dry county, wet
I
county
know.
too, back in the day.
I know, that's interesting.
Right through the center.
So a township could elect to do their own planning and zoning?
They could.
Yep.
I don't know why they would, but
But now that we've been under but the building is different. Now, the entire county has been under the building code. It has to remain that. If they can split off and hire their own inspector if they would want to, but he has to, or she has to enforce that state building code.
Okay. I didn't think anybody was looking at that or asking. I just was curious if they had the,
You get into like Dakota County and stuff, the townships have their own planning and zoning department.
They do.
And everything. I mean,
each township?
They can.
some of them.
Oh, some.
Not- Yeah, Some of them rural, urban. But they're, it's kind of like a city.
Stockholm
Yeah.
Township and Wright County have their own code,
Really?
have their own inspector separate from Wright County.
Because Stockholm's just south of Cokato, isn't it? Yeah.
They've hired their own independent inspector compared to the Wright County inspectors for septic and building code.
Interesting.
A lot of variation.
But it's still the
Yeah.
state code. You still have to enforce the state code, but they've been hired their own independent.
Interesting.
Yeah. So the building department, on average, we average about 308 building permits a year, and that's over the last 15 years. But it's been about 423 in the past 5 years. We've issued 534 permits in '23 and 519 in '24. Some of that in the last couple of years is due to the storms that have come through the area the last couple of years. Here's an example of what Brian gets in for blueprints and drawings. He inspects and makes sure on paper before it even gets started that everything's up to code. Got a couple pictures on the framing process, the mechanical room, heater, water softener, and what. His inspection process starts out generally with the permit coming in. He does a review plan, and then he'll issue kind of a criteria, what he wants to see for inspections. And generally that follows through on a footing inspection will be first. Then it'll be a framing inspection. Then it'll be an insulation inspection, mechanical, plumbing, roofing, siding, and then windows, things like that. And then eventually it'll be a final inspection. And on that final inspection, he has a walkthrough, and he'll look at things like stairs, rails, guards, and if it needs to be accessible. He'll look at final plumbing fixtures and things like that, if things are kind of more safety issues. If anything looks like it's a slip trip hazard or anything like that, he'll go through on that for the final inspection. So that's kind of his process. So there's a series of inspections that goes on with each of these permits, as well as electrical that happens, but that's a state permit. We don't issue as well.
I was impressed when we built 2 years ago, because they were looking for every pinhole. There better be foam. If there's a gap, there's gotta be foam insulation or some type of insulation. I mean, they were very particular every step of the way. And you don't get that, what do you call it, certificate of occupancy,
Yeah.
unless everything's,
The code is really to our advantage because
It
it's
is.
very protective of our real estate and buildings. But a lot of it is a lot of the code is written and contributed to by insurance companies because they want to protect themselves. And so when we have this kind of code here and we have inspectors that are following it, it's to our advantage, to our property values.
well, just to give you an idea, once they put the roof on, they came out and checked to make sure that all the cribbing that was necessary was put in there so that it would be able to maintain the snow load.
Yeah.
You know, it's just all those little things you don't think about as the average person, you know, but, so, yeah, you're absolutely right, Cheryl. It protects us if we're buying a home that's already been pre-constructed, you know it's up to what it should be.
That is one thing that Brian does with blueprints comes in. He does make sure snow load, like you talked about, is up to spec. It's not always the case. People want to, it's a lot cheaper to not have Minnesota snow load requirements. Like you mentioned, the thing about the footing sizes, it's a lot cheaper if you don't have the correct footing sizes. It may look right, but if it doesn't calculate out right to handle the right loads, that's what Brian's looking for in part of the code as well.
Absolutely.
Those levels of safety, so nothing collapses in the future. So, yeah. So next department I'll talk about is the septic department. And that department is staffed by Brent Radke and myself, as I started out as a septic inspector with the county a few years ago. This department is also designated by the state of Minnesota through the Pollution Control Agency and the Minnesota Department of Health to local government units to handle all aspects of enforcing the code pertaining to subsurface sewage treatment systems. And this is found through Minnesota Rules Chapter 7080 and 7083. And the county staff manages the program by conducting site inspection, system design, location, installation, and maintenance. Also perform plan reviews and documentation, implement and enforce The ordinance, state laws, and rules pertaining to septic systems. Now, kind of the plan for this is when somebody comes in with a septic system, we'll get a design, or we'll get a design from a designer, then we'll go out on site, meet with the actual designer themselves, and verify that his design matches up with the soil types and the soil characteristics that we find on site through soil borings. Then we mutually approve this design, and then that gets and then we pass it, and then eventually it gets built to specs as we see. But we always meet on site with the designer. We don't go out separately. Some counties go out separately. We always meet on site so we can kind of, at the time, when we're on site, we agree to a design, we agree to a depth, we do that on site. So there's no back and forth between us. We kind of know when we leave the site, what has been approved for that site. So when it comes back to be built, yeah, this is what we saw, this is what we see, this is what we agreed on, and this is what, yeah, so that's what we do at Meeker County. Not all counties do that, but we do that here. So the Meeker County ordinance requires septic compliance inspections for the sale of a property with a habitable dwelling if the existing septic system is more than 5 years old, or if the septic system has not had a passing compliance inspection within the past 3 years. Requirements for upgrading a system are also required for any new construction permit project located in the shoreline district. So even if it's, any construction project in the shoreline district, we require a compliance or a passing septic system.
Even to shingle your house?
No, not for maintenance permits.
Okay.
Yeah, that's everything but maintenance permits. We consider shingling,
that intentionally,
windows,
because that's
doors, and sidings, general maintenance permits. Yeah, we have not enacted that as of this time. Correct, so.
I had to ask that one on purpose, Craig, because that's you know what you're smiling too, that's
Exactly. So, all the inspections and plan reviews are geared toward protecting groundwater health and safety. Yeah, everything for sewage system is basically to deal with protecting the groundwater, things not getting in the groundwater system. That's all geared towards. On average, we average about 126 septic permits per year. Here's a picture. On the left-hand side, that's a 1,000-gallon septic tank. If you haven't seen one, it's been unearthed. As you see, there's a riser on the right-hand side of the tank. We have to have, there has to be a riser that goes to the surface on every tank for accessibility. So that's one requirement. Those tops on those risers are about 75 pounds, so it's not easily accessible for kids. They are pretty heavy. And on the right-hand side, there is kind of the guts of a mound system or pressure bed system. But you see the PVC laterals there. They're either 1.5 or 2-inch laterals. That box, you see that black box there? That's where the actual influent comes in and gets distributed through that. And those 3 laterals, there's a pump at the tank. The septic tank will pump to those laterals, to that black box, and it'll be distributed out to those laterals through a distribution system, which is generally usually rock. It's usually almost 3/4 to 1 inch rock. And that's generally about 6 to 8 inches deep. And in those PVC laterals, there's a hole about anywhere from 12 inches to 24 inches, depends on the length of those runs. It sprays out the sewage equidistant across that whole area that's rock that we call the distribution area. So then that effluent goes down through the rock, kind of disperses out, and then then we get another layer, anywhere from 1 foot to 2 feet of sand below that. It's distributed even more. And that's where your microbial action really takes place in breaking down the effluent. In layman's terms, it would just be kind of starting to purify the water and taking out all the bacteria and that makes it happen. By the time it gets through the profile, ideally, it's pretty clean and fairly safe as it does get to the groundwater table. After that, it's safe for the groundwater table at that point. That's kind of the process. Any questions on that?
Yeah, I'm just, so that is essentially the mounds.
Yes.
And
Underneath
that's
the
the right side, the right side is what's underneath the mounds then?
Yep, the right side. The left
And
side
so-
is the tank that pushes the effluent and the
so-
sewage to the mound.
So the mounds are necessary because you don't want it,
Yeah, so we have to have,
you need the space to get to the groundwater
the
before,
codes, The code says you gotta have at least 3 feet of separation from what they call mottled soil or groundwater conditions. It's not pure groundwater in state. If you dig a hole, you're gonna get water in the hole at that point, because that's usually a lot deeper. But what it is mottled soils, 3 feet above the mottled soils. And mottled soils are soils that tend to be, you're dealing with black soils or clay soils, or grayish black soils would be more mottled, have like reds highlighted on it. Over time, there's been, that layer of soil has been underwater or waterized for greater than 50% of its life for hundreds of thousands of years. It'll change color. It'll be gray. It'll become reds if it gets a high iron content, stuff like that, magnesium, stuff like that. It'll bring those colors out of the soil, out of the black soil, and make it multicolored. And that tells you that the breakdown of the water, the saturating the soil, does that over time. And that's the layer that we go up to, and everything at least 3 feet above that. So that rock, the sand at the base of these mounds has to be at least 3 feet above what we consider mottled soils. So that's all it's called.
And then your mound, actual mound, what you're gonna put over that is gonna be another 3 feet?
Well, we'll have another foot over the laterals and minimum, and then we'll have another 18 inches of topsoil over the top of that. I mean, that's where you get the whole, like, people call them submarines in their backyard. So they'll be generally anywhere from 3 to 6 feet. In some places, we have to put 3 feet of sand underneath if the mottled soil is that close to the surface of the contours of the land we're dealing with. So, yeah.
Hence-
What percentage of septic systems now are you seeing as mounds rather than just the more traditional?
Oh, mound and pressure bed, I consider pressure bed kind of the same, because it's the same design, just more level.
Right,
Oh, I'm sure it's 75%.
mound, the higher
Very
mound.
rare do we see trenches anymore. Trenches are usually only in super sandy soils and with a little bit of elevation. And even on top of elevations, you'll find, sometimes we'll have to put pressure beds and mounds on top of elevated systems if it has a high clay content. Because the high clay content will hang on to the water.
Longer.
And reduce those soils. So it's well over that, probably even 80 or 90%, it's a lot. And I think people now, generally, they just err on the process that if the code changes. So it's spent, right now, the average price of septic is about $18,000 for a 3-bedroom. It's very expensive.
Yep.
So you don't want to err on the side of, do I want to take the risk of being within a few inches of that profile, or do I just want to raise everything up and know I'm good for the next 20 years? That's kind of the consensus. And I don't think that was consensus in the past history, but it is now, because it's very expensive.
But there's also maintenance to those.
Yes, and like this spring, if you probably, I don't know if you had calls or not, but we get calls. There's been a lot of freeze-ups this year because there's been no snow as insulation to these systems. So with that, you got cold conditions, you have no snow insulation on the surface of the land, so we've had a lot of freeze-ups. Even 4, 5, 6 feet down. It won't take much for a septic system to freeze up once it gets snowballing. You get a little bit of freeze, especially those that are cabin people and people that have gone south for a month or two or a couple of weeks. There hasn't been enough water use in it. They just have something that's slowly dripping in their drains. It'll go through the line and start to freeze up, and then it'll compound on each other and build up in the pipe. Eventually, it'll block that pipe. So, a year like this year has been pretty tough on them. About 3-4 years ago, was a pretty tough year too, if I remember right. So,
Freeze-ups usually happen too after it starts to warm up, because the warm air actually pushes the frost deeper initially, so you usually freeze up more late February, 1st of March, after the cold is kind of behind you already, but.
any more questions on septics? Next department we got is the Geographic Information Systems Department. And this is currently staffed by Teresa Leaser. She's full-time, and she's responsible for the performing and directing activities. Prior to the Geographic Information Systems, cartography, this is done by using computer software, capturing and storing and checking and displaying data related to positions on the Earth's surface. Go to the next one. This is what she's responsible for putting this in our beacon site. As you can see, locations and boundaries of districts, properties established by ordinance are set forth in zoning maps. Also by legal descriptions. So anything like we do splits and lot combinations, different zoning districts, planning commission, after you guys get done voting on this stuff or it comes through the recorder's office for splits, she gets that information and updates the mapping for those types of sites.
Correct me if I'm wrong, didn't we do a new pictometry a year ago?
Yeah, that sounds about right, yeah.
Yes.
Yeah, it's uploaded in there.
Yep.
Okay.
So she does that, works closely with the land use group, recorder, auditor, assessors, highway, and even sheriff's departments too. She works a lot with them. She makes mapping for the county updates, timely manner for appropriate property boundaries, road boundaries for law enforcement locating purposes. Most readily portion used of the work input is the county's beacon mapping site. And that's used daily can be used by the public as well. If you just type in beacon on our website, it'll take you right there. This is used a lot. Next department I have, the Aquatic Invasive Species Department. This is staffed by part-time employee Ariana Richardson. She's the AIS coordinator and works closely with the Minnesota DNR. She provides oversight to the Land Use Department for coordinated facility implementing county's AIS program by working closely with state, local, and federal governments and nonprofit, private organizations to develop and implement AIS prevention programs. Some duties of the position are to provide information and education to lake associations, like property owners on AIS issues. This position also works with lake groups to monitor and map aquatic plants to develop native plant protection and invasive plant control plans. The position tries to develop a strong partner and volunteer network as a goal, which helps in ensuring coordination with the mission of the AIS work plan. Currently, Meeker County receives approximately $226,000 in state grants for AIS. We also use approximately $60,000 from the balance fund. One used previous year's funds to add to the AIS grants, and these grants allow individual counties to make decisions on how funds are to be used regarding only AIS issues. Funds must be spent according to state statute while still abiding by all current laws and regulations. Funds for this program in the past have been divided by projects such as boat landing inspections, AIS water treatment, education outreach to lake association members, along with the general public and program administration. During your consent agenda today, you voted for the watercraft inspections contract with WaterGuard. It's $138,000. That was part of the AIS program that she coordinates and sets up.
She located in your office space back here?
Say again?
Her office is back in,
Yeah, she has a cubicle
seen her
back
for
there.
a long time.
She used to be up in the treasurer's office,
Is that
in the
why?
courthouse, and
Okay,
then,
yeah, I haven't seen
and then
her.
she temporarily worked with us, and
But
now she's in her
back
final
there.
space.
Okay.
She's got a space there. So,
And she's like 20 hours a week or something?
yeah, 26 hours a week is when she
26.
works. Yep, correct. Some examples of aquatic invasive species. Zebra mussels,
Ugly little
clams,
things.
giant crayfish, spiny water fleas, milfoil. This picture to the right is a mobile kind of decontamination unit we just acquired last year. And that was actually stationed out at Lake Ripley. It's got a vacuum on it. It's got a small water tank on it to hose things off. It's got air pressure on it as well. That was used on the west side of Ripley last year for people.
You never move it, it's always there?
We didn't move it last year. It just
Are you
came-
going to?
I don't know, I'm not exactly sure.
We had one at Minibel.
Yeah, Minabelle has their own.
Oh,
Has
they
their
have one
own.
already.
They have
That's
one.
right, I remember that.
Minabelle has one permanently stationed
There
there.
was one at Washington for a while too.
Yep, south side of Washington.
So is one of these, which is our biggest issue right now? Is it with the invasive species? Are they all bad, or?
I think they're all bad, but I think the main one that really, people really don't want in their lakes is starry stonewort. That, from what I understand, is the
correct me if I'm wrong, Greg, it creates kind of a mass atop the water. Coronas has it up there by Painesville, and you know, if you want, you live by a lake to be able to recreate in the lake.
Sure.
And so I don't know, I can't say that it has affected their property values, but it certainly would be something a new purchaser or buyer of a home would be looking at, can I use the water?
Absolutely.
So, and then the boats that go fishing there and then come and go fishing in other
Yeah.
lakes potentially can spread it. Zebra mussels are a little nasty too.
Zebra mussels, I understand, for people who like to swim and use the water.
That was the talk a few years ago, but I haven't heard about zebra mussel lately, so I thought
We,
maybe there was.
we've got Minnie Bell was infected with them,
Stella. or-
Stella.
I think every lake has them.
I don't have the names offhand who has what, but
Do we have any way to track how we're doing? Is this like something that will, eventually it's just gonna be everywhere? I mean, do we have any ability to contain these invasive species?
contain them.
I mean, or to keep them out of certain lakes, or is it just,
Well, I think the consensus on the AAS board is to have so much money piled into the inspection process, to try to nip it at the bud before they bring it into a lake or take it off of a lake, to try to stop the spread. It's transported from boat to boat.
I think they're all in
And
every
Starry
lake.
Stonework was the biggest eye opener for everybody, I think, in the whole area up in Coronas. That, I think, my memory serves me, it might have jumped from Michigan to Minnesota in one shot.
Yeah.
so, I've heard that it's not a matter of if, but when. So, once these invasive species are in our lake, is there anything that can be done about that, or it's just,
Well, they're working on that.
okay?
That's a constant battle by the DNR and water specialists to try to figure out how to handle this. With not only handling the invasive species, but not destroying the current ecosystem
Right.
in the lakes themselves. So there's a fine, they're trying to work on both things. How can we get rid of one without getting rid of the other?
Right.
That's on a level.
And we have so many lakes that are connected, and I'll just use example, Minnie Bell comes down Sucker Creek, goes into Manuela, Manuela goes to Stella, Stella goes to
Stella's to
Washington.
Washington.
Washington feeds off into the Crow.
Yep.
So, you can really have a chain effect. One thing I did wanna just remind everybody, the funds that we use are pass-through funds. We don't use any county money in AIA, well, a modest amount.
No, we don't put any levy dollars into the AIS program.
Right, oh yeah, that's MCAL.
Yes, MCAL is different.
I get those
The
two
AIS program is, we don't put any
It's
levy
all
dollars
pass-through.
into. It's, I wouldn't call it pass-through because it's not money that we are receiving then handing over to another group to do work with. It's restricted funds.
Yeah.
And we're fortunate to have a lot of lake groups that do a lot of work on lakes, so.
And we're getting
Actually-
more lake groups on board all the time.
And the better, the best control is where you have an active lake association. I mean,
It's what?
where you have an active lake association working on it.
Right.
Is where they have the best result.
And the funding mechanism is based on the number of parking places that you have at your landings.
It's boat launches and parking
Yes.
spots. Yep.
Yep. So,
Interesting.
Next department we have is the landfill and solid waste department.
one of our favorites.
Done a meeting on that in the last month or so, but this department is staffed by Brent Radke, Gary Lindenfelser, Tom Downs, Monica Ankrum, and myself, all the county's currently employees that consider part-time in their solid waste duties. This department oversees the county's solid waste transfer site, which coordinates and manages demolition landfill activities. Department also manages the county recycling sites and the use of SCORE funds by coordinating and assisting municipalities and waste operators with recycling programs. This is done by providing options for and managing the county's household hazardous waste program. We have agreements with Candy, Ojai, and McLeod County to bring our household hazardous waste to their counties at this time. We don't accept any household hazardous waste at any of our sites in Meeker County currently. Currently, the county hires third-party company Endurance Environmental to staff the site for Fee collections, daily on-site operations, hauling approximately 15,200 tons of solid waste a year that comes to the site 6 days a week, 5 or 6 days a week now, to Spruce Ridge facility at Biscay, Minnesota. Demolition site recycling, upkeep of the site. Transfer facility is managed by part-time employees mentioned previously, mainly Gary Lindenfelser and Tom Downs are at the landfill site running the dozers and cats. So, a couple pictures of the site, our transfer station site, and the blue bins in front of that is our recycling bins that any county employee or county resident can come in and use for recycling. Plastic, paper, glass, cardboard, and all that, and then that gets dumped every week or so. Waste management comes and gets it and takes it to a larger recycling facility. So,
And just a word about our reciprocal agreement with McLeod and Candy, Ohio. I've been at the McLeod one. I took a bunch of old paint there, and it's very easy. You walk in, they give you a roller cart if you have a lot. You take it right out to your vehicle, you put them on, you go in, you sign. That's all that you're depositing. It's so easy, it's just a matter of, you gotta be going there, but, matter of fact, they've got a great big room where if you turn in 4 gallons of paint, they label them and it can be picked up and used by somebody who needs it, so.
They have a good thing going over there. I've been over there too.
Yeah, it's very clean, very neat, easy to use, so.
it has the same type of facility in the city limits of Wilmer's too, as well, that Meeker County residents can use.
Have we changed the sign and et cetera out there?
Yeah, it's being changed.
I got some
I've
phone
ordered
calls on
some.
the weekend, so it was a
I did.
mess.
Have you had anything recently?
too.
Well,
As
no,
well. I
not
did as
since
well.
2 weeks ago. Everybody had calls. I mean,
Yes.
you got 15 people lined up trying to get into a place that says it's supposed to be open and it's not, so I'm assuming that's been taken care of.
Yeah.
Has the website been fixed?
Yep.
Did you get a call too?
Yes, I did.
So did I.
Any more? So then there's some additional department information. So, as mentioned, we also work and coordinate with the assessor group, the property records, treasurer, highway department, even in county attorney on enforcement issues. New move to family service buildings has brought the property records group into the same office as we are in right now. Assessing group, which is now in the same office facility as we're at, is currently led by Missy Voigt, staff with 5 others, in-house personnel, Lisa Linden, Shelley Miller, Travis Skobach, Michaela Stady, and Kristen Greenwald, with outside appraisers Jane and Gary Grossinger, that collect assessing information as well. Assessor's office directs plans and supervises the appraisal, valuation, classification of all property in Meeker County, as prescribed by Minnesota statutes and directives of Commissioner of Revenue. Meeker County has approximately 18,000 parcels, which are either viewed by county appraiser staff and/or local assessors every 5 years. The other group that's within our office space now is Property Records Taxation and Elections Group. It's currently led by Barb Locke, staffed by 3 others, Becky McCarthy, Stephanie Grosskreitz, Holly Litson, Pixie Mumford. This department is taxed with recording of official documents such as deeds, mortgages, bankruptcies, liens, probate papers, plat maps, government surveys, military discharges, and tract indexes. Digital imaging of most of these documents can be obtained by contacting the recording staff. The auditor function of the department maintains financial records for the county, which provides the annual financial statement for the county. Election duty of the department also oversees both local, regional, and national elections, fairness and security of votes. The department also handles passport processing for customers. So, they're all now located in the same office space as we are in.
So you moved in there in December?
December.
Have you heard any comments from the general public about where you're at now?
Well, initially it was hard to get to because they realized there's parking in the back, but that's kind of changed. There's some issues with the windows, can't hear as well in the windows. Gets to be, it's not as personal. Have to talk louder, they can, if they're older, they have to really listen or whatever.
You weren't hoping to hear something positive, were you? I kinda
Yeah, it kinda
but
was.
I should've known better.
But I think
The
it's,
office staff, I think, likes it. It's brighter, it's way brighter than the old
Wow.
place.
It's nice to-
Good visibility. Haven't heard too much complaining about that.
I do like the privacy portion. And I do have a little issue sometimes with hearing, but I have to be honest, I have not had, personally not had any problem if I've come to the window there with hearing. So, it's, but I was just curious what kind
Just
of
on our
comments you had.
staff, and if the multiple windows are busy at once, it can be a little bit chaotic, the listening. A little bit of this going on.
Yeah.
But that's not that often. You know, you generally, there's maybe one or two at most that are at a window and run different settings. Sometimes there has been multiple people at different windows. If you've got all three or four of them going on, it can be a little bit, but that's.
And you do have the ability to bring somebody into the side room or whatever, do one-on-one if it's an issue, but I know I've had a couple of comments too, people that aren't crazy about talking through the glass. It feels a little weird, you know, to them if they're a regular visitor, you know, or stop in. It's different, so there's some adjustments, but
People that are used to it, it's different for them.
yeah.
Especially the interactiveness of it, like the computer screen or something now, it used to be able to just swing around the screen, is this what you're seeing? Well, now you can't do that as easy.
Can you fix all that?
A lot of that happens at the window.
The windows.
We're kind of talking
Sounds
over
like we're
things, but it
doing
goes,
it.
it's not as, it's a little clunky.
Yep,
But we're learning.
You hear the complaint.
make some adjustments, yeah.
Didn't expect it to go smooth right off the bat.
Unfortunately, we're more likely to hear complaints than we are to hear
The positive
positives.
side. It certainly is a brighter atmosphere when you walk down that area. It's got that nice big waiting area also, so people don't have to be standing right
Oh,
behind you when
sit
they're
on the
waiting
way.
in line. So, that's
No,
good.
I've heard very good comments about the lobby area and stuff. You know, people like that countertop and, you know, different, you know, workstation. They can do a lot of things there. So I've heard real positive about the area. The glass is the only thing that's brought up a conversation piece in a negative light, so.
Any other questions for Greg?
Anything else?
Hearing none, I guess we'll say thank you for giving us your annual report.
Thank you.
I'd ask you, are you hearing anything in the pipeline about possibility of issues coming down? Anything, any of you in your conversations with people? Or anything?
Issues about,
Anything, any possible programs?
just about keeping the solid waste open when it's supposed to be open. I certainly heard plenty about that. That's all I've heard.
No, I haven't heard anything brewing, if that's what you're asking.
Yeah, I just want you all to know that my door is always open. I think those of you who worked with me in the past know that, so make sure that that's always there, so. Try to get the information I can to you when you need it, so.
Thank you.
Yeah.
Yep, appreciate it, Greg.
Andrew Letson.
Late.
So as as we talked about at the very beginning of the meeting today, you know, we have a request from Clay County to provide a letter of support, for funding of a project that they are getting some state funds for. They're looking to, remodel an existing facility and then build a new facility for, juvenile justice, right? Looking to have an 18-bed psychiatric residential treatment facility, in an existing, space be renovated, and then also build a new, less secure facility for individuals, and that would include a number of additional beds there. 40 beds is what it would provide. So we know that you know, when we run into situations with juveniles, you know, our law enforcement does on the street, it can be difficult to find adequate placement for them. So anywhere in the state that we can expand, you know, beds, the better, because it just provides, it helps to relieve the system as a whole. You know, that we have a facility that's located in Wilmer that we're able to use when there's space available. Otherwise, our law enforcement are driving folks across the state to find adequate space. So while this facility itself may not be one that we are using directly, expanding capacity there will loosen things up to allow for facilities that are near to us. So that is the reason why I would recommend that we support this project. There's no financial contribution from the county. It's a letter of support, and as you've seen in there, Clay County's been successful in receiving statements of support from a number of counties across the state.
We had a chance to visit with Clay County, their folks at Legislative and at the annual meeting, and they have worked very hard to put this together. They know the importance, and I would hope that we would all support this letter to support them in their effort to add the additional beds.
And I would just add, Mr. Chair, yeah, Clay is David Ebinger and Jenny Mojo
yep.
out of Clay Commissioners. Through public safety, this really has been being worked on for probably 2 years already. If not, they'd probably tell you 4 or something, but to my knowledge, they've got a couple of years into this, and there's short beds throughout the state. So, I mean, whatever we do to increase beds and really this letter is kind of the small part that we can do to help alleviate some of that pressure and bring the service forward. With that, I'd move to approve a letter of support for Clay County Psychiatric Residential Treatment Facility Project.
We have a motion by Commissioner Schmidt. Is there a second?
I'll second.
Second by Commissioner Van Ort. Is there any discussion? Hearing none. I want to make sure that this isn't a resolution, so I get
It is
directed.
not.
So, all those in favor say aye.
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 Opposed, same sign. Motion carries. Thank you.
And then I just have a very brief report today. It's just that we're going to have a work session next week. We have 2 items on that. Our county assessor is going to come forward to discuss the current abatement policy that we have and then look to update that. And so we want to get some feedback from the county board on that. And we're going to have a discussion about the possibility of adopting a tobacco-free campus policy. So that's the items that we have on the agenda for next week.
All right, thank you.
That's gonna be
Andrew?
welcome. I walked through smoke coming in again this morning.
Moving on.
Can I ask about the work session? And I was gonna talk to Paul about this, but I was hoping to be able to present that decision-making conference I went to earlier in the month.
How long does it take?
15 minutes.
I'm serious. You lose me after. Why are you laughing, Steve?
No, just the way you said it. I'm just.
Will you be providing
And,
cocktails or no?
Can add it.
Donuts.
Oh, yes.
It depends on what decision you make.
Well, I
I think it's a fine
Andrew?
idea.
think that's a wonderful
How
idea.
long are the other 2 presentations?
I would imagine that the abatement policy may be 20, 30 minutes to
That's
get people
fine.
to speed, and the tobacco-free campus, again, 20, 30 minutes is what I would expect. So I think that we could easily fit 15 minutes, 20 minutes on the agenda for that, for next week.
You're gonna get a card that's worth $50,000.
Wonderful.
Just saying. Pique your interest.
Okay.
I think you'll add it then.
Yes, we'll add that as
Are you buying
Based on
raffle tickets
consensus.
for each
You're
of
not
us
gonna
if
be
we
here,
attend?
Paul?
Is that what you're saying, or what?
No. I'll explain it
Lottery tickets?
when we get to it.
Okay.
Same thing on it.
Wonderful.
So we'll add that to the agenda then, Commissioner Samke. Moving on to our Board of Commissioners Committee reports, and I'll ask this question, who's ready to go first?
Not me.
I
got
can
a
start.
lot
I
of
didn't have
stuff.
much, so, I had Prime West. We didn't have a finance meeting because we'll do 2 months next month.
Yeah, we're in the in-between.
And so we're kind of in an in-between stage. We had a report on how Karma's coming. Our lobbyist was there, and we talked to him about what's coming down the pike. He said St. Paul is very interesting. Never seen it quite this interesting. I don't know if he talked about anything too specific. Paul, I didn't have a lot of,
Prime West this time was more one of those meetings where you just kind of do your policy changes
Right.
and your different things that have to happen for the new year.
Yeah.
So we went through a lot of that.
a lot of stuff. Some of the information we get is interesting, statistics like, child visits are up again
Yeah.
finally. They were down during COVID. mental health utilization is up again. So we went through some of that kind of facts, I think, with Scott or whoever did them. That were
Scott, yes.
interesting. He's always, the doctor, he's always got interesting. So that was just kind of whatever. I also had a governing board, exec committee meeting. We talked about needing an IT assessment, which I think, I don't know if Mary Ellen talked about that here. We're working on perhaps looking into closing Locker B up off for when we put the clinic on. That's still, she's been meeting with the city about that. Went over the final version of our organizational goals, which I think will be on the website if they're interesting, pretty simple. The mission is providing compassionate care to each person, supporting community health and wellness. And we did not move any semicolons, Paul. Just so you know. Inside joke. What else did I have? And then I had Central Minnesota Jobs and Training. It wasn't too long of a meeting, but we had some financials for actually the first time since I've been on, because they've been going through audits. Those are all over. Everything is fine. They did some very interesting financials. They're doing some different kinds of reports. They've been under an audit. There was some issues for the last, couple over a year.
Yeah, it'd be a
Steve, you
couple of years.
thinking? And Steve passed it off to me before I knew all that, so.
Well, things were going smooth when I was there back.
Of course they were, what was I thinking?
But,
The abuse I take.
did they hire a new?
Dina
director?
she was the interim.
Yeah,
And
okay.
she's doing it. We have a new CFO. And so they put some new things into place for safeguarding. And it was really a upbeat meeting. And I think everything's just getting back in place and is gonna be fine. And, Paul resigned from the board. Workforce board he was on. I gave some information to Tina, cause I met with her that day a little bit, so she kind of introduced herself to him, so.
Is their activity pretty strong? I mean, do they have a lot of requests? I mean, CMJTS, does it seem like it's a heavier workload, or is it?
I don't think so.
still
They
pretty
had a
steady?
strategic planning that I couldn't attend, so there's gonna be more out about that. But I just think that, there's some new software going in to do some safeguards, and, they have a copy of the grants now with the expenditures and what's left. Some stuff I haven't seen that maybe they had before when you were there.
Okay.
So I think they've all worked very hard there, and I think they've moved into a really good direction, so.
I know the past director, Barb, she had actually taken over in a similar situation. So I don't,
Yeah.
it almost seems like there's a chronic problem with maybe
Yeah, I didn't
within
realize
the-
that, but she was there 20-some odd years, I think, so, before she retired, so.
Okay.
But it was all pretty positive and upbeat, so we will see. And that's all I had. Okay.
So I went to the Drainage 101.
I bet that was exciting.
That was good.
Serious.
They just gave us a history of the drainage system and how projects and repairs get done and, who benefits, just a basic overview. I thought they did a great job in explaining it, and so did that. And then
Can I jump on that one?
Sure.
Since I was there too?
Yes, absolutely.
I have to say, it was interesting because I think Cheryl and I were asked the most questions of anybody.
Oh, that's good, though.
Good.
Because we were the commissioners. Everybody else seemed to be like, board
Inspectors.
inspectors.
Yeah, auditors.
But at the same time, it was like, the history was good, but it was a little frustrating because they're using the acronyms and I have no idea what they're talking about. So I stop and I ask, we're gonna get to that in the next session.
Yes.
If you're gonna use the acronym,
Then
please let
explain
us
the
know,
acronym.
because
Yeah, exactly.
it'd be
Yes.
helpful,
Yeah.
So, but yeah, I think Cheryl and I were actually quite engaged. I don't know if we
I thought
annoyed
it went well.
anybody because we
You may
kept
have.
asking.
That's your
I
job.
don't think you did.
But they kept saying,
This is where
we're
you
gonna
say,
get to
I
that.
did not.
We're gonna get to that. It was like, so it was, anyway, we learned, I
I
think, some
tried,
things, but
but, okay.
So
No.
anyway, yeah, it was good, but it was interesting having Kale behind me, and then we had.
Yeah, Rinky Noonan was
yeah.
there represented.
So they were kind of the resident experts, and they did a lot of tag teaming with different things, with some of them, a lot of slides.
Yes, but they did have coffee. So,
One thing on ditches, before we leave that subject, and I brought this up before, and I've been getting pestered on a little bit from townships, and I don't know if there's some sort of information we could put together to give township clerks or supervisors, something we could mail them, a little packet or something on ditches, just to give them a general understanding, because, you know, they see ditch bills on their taxes and they end up with a lot of questions, but I don't know if that might be a more
The
complicated.
township people don't understand the ditch.
Not as well as
But
you would think, the
Interesting.
whole assessment process and,
Oh, wow.
and, you know, a lot of the main question I get is, do we know what's coming? You know, when we see the bill, we don't a lot of times see any work done in the ditch, so we're wondering what that all is. And kind of a breakdown of where the fees come from.
Because the work might be on a different part of the ditch, but they're
Yes.
getting, yeah.
And
that
part
makes-
of the ditch inspector salary
Yeah,
comes into
there's the
that.
general administration piece of
There's-
it too.
yeah.
And to some degree, a lot of this parcels of land have been handed down through inheritance, and those folks don't farm it.
Yep.
Yeah.
They're doing other things, don't understand that part of it, so yeah. you
So I
make a
thought if
valid
we could
point.
get that, I don't wanna overcomplicate it, but if something, get a little more information.
You'll see if there's something good out there. You know, we talked about
Yeah.
that before, and I'll talk with Barbie.
So Cheryl, did Rinky Noonan lead this training, or was it someone else?
so
Hannah was,
there was a Bailey, from ISG Engineering, also Scott Henderson, H2O Overviewers. Okay, and then, also, Hannah Jansen with Rinky Noonan did most of the presentation.
She did.
For them, yes.
Okay.
Yep, so, yeah.
Scott, before he was with H2O, he used to be the Sauk River Watershed District Executive Director or whatever.
Right,
For quite a
right.
few years, so.
Yep, so that was it was educational, it was good, answered a lot of questions that you'd have about who benefits and who's responsible, so. Then yesterday, the committee with the extension committee, the Farm Family of the Year group met. Yeah, that was fun. You know, we'd gotten, 3 new, applications or recommendations, I'm struggling to come up with the word, but, nominations. So, we did choose, and of course I can't say at this point, but we did choose, one family, a farm family, and then we also did choose a couple of backups because occasionally, the person who is nominated and is chosen will decline. So we do have a couple backups and,
That's fun.
yeah, yep.
Will it be as fun as Extension Budget Committee?
It is way more fun, and they did mention that they appreciated my, my quick response to their request for someone to join them.
She jumped on.
They
the
got
Farm
2
Family
options, and
left
I said,
me
I'll
with
take that
budget.
one. Steve had barely moved, and I'm like, yep, I got that one. So, no, it was great. It's great to see the different, not just cattle and crops, but also fruit and berries and sweet, we have a wide variety of agricultural entities here, so, okay. so
Today
that-
is National Ag Day,
Okay,
and actually Meeker Farm Bureau has sponsors an Ag Day Gala at the State Fairgrounds this evening. And I'm supposed to go there tonight to, represent the Meeker County Farm Bureau.
Will you be wearing is it black tie?
It's a formal.
Wow.
It's Meeker sponsors a table, I think, of 11, so then you bring in different
Fun.
ag business people or ag leaders from around the county to your table and stuff. So
it's also National Awkward Moments Day,
Yes,
so,
saw that. I had
I'll
too
have a
many
couple
numerous to mention even.
Yes, so, that being said, I have nothing more to share. So.
Was that awkward moment when you said your comment to Darren that? no,
Yeah,
they really-
he didn't say anything, he wasn't.
What comment did she make?
I was hoping for a reciprocation, however, I did not receive one, and that was awkward, so.
We'll fill you in later.
Never mind.
It's all right.
So your committee assignments, reports, or whatever you would like to share with us.
So I was originally on Wednesday, the 5th, was supposed to have the North Crow River watershed meeting, but that was canceled due to snow, and that was a weather issue. So they just said, yeah, they didn't have any actionable items or anything, so they just canceled that.
April, the next one, I think.
Yes,
April,
I think so. And then, again, the drainage meeting that Cheryl and I attended was, we've already discussed. There was supposed to also have been a joint, meeting in McLeod Sibley at the Hutch Fairgrounds, but they moved that to May 2nd.
Yeah.
So that is not going on. But then there was a virtual meeting, for local workforce boards. And for whatever reason, that was I'll be honest, it wasn't particularly helpful. I'm just like,
What was this for?
it was a virtual, local workforce boards. And I was on that and it was like,
Is that through MMDC, or do you know who's?
I don't know how that fits in because
might have been
Central
MMDC.
Minnesota Jobs and Training has workforce board.
Yeah, they were trying to explain the whole workforce board, and I'll be honest, I sat there and I was like lost. It was like it was not
I don't know.
particularly helpful, to be honest. But then there was the next day there was another one on the interconnected. This is what I was kind of excited about: shifting landscapes on migration patterns in Minnesota, and I couldn't get on it. It didn't have a link. That was very weird.
That AMC's.
Yeah, yeah. So
That's
then they recorded it, so I figured I'll just watch it later, which, whatever. And then yesterday we had, I got to enjoy the Minnesota Rural Counties meeting, and so, but that was actually pretty helpful, because we had a bunch of stuff going on there with, just really dealing with, the legislature right now with all the different things going on with the governor's budget. They did mention that the budget forecast for 26 for 27 was they were supposed to be 456 million to the good. But then for 28 and 29, we're going to be not 5 billion, but 6 billion in the red. And so there's a whole lot of federal uncertainties because they're concerned about the different impacts the federal budget's going to be having with all of the turmoil in Washington. So again, they figured that we're going to have a surplus of in 26 and 27 of 790 million, but then the Health and Human Services budget was going to be 338, and then the other part, the major part of it is the E12 education was going to be 198 million.
And the two pieces there, is HHS and education are two of the biggest components of the state budget. And actually, I think HHS right now, as you said, 18% or 20% of the budget right now is HHS. That number is gonna go in the next 5 years up over 40%. Is projected, and that's a really worrisome issue.
Correct. Then they kind of reported on the MRC main issues, which we've kind of are somewhat familiar with their solid waste concerns, the e-waste and the battery products. They felt good about that because that's kind of a bipartisan issue that they've been getting some support from both sides of the aisle on. And then the other one is the ACT, that
African American Child Disparity.
Yeah.
Something.
MAAFPCWDA.
MACFA or something like that they
Yeah.
call it.
And really, the one big issue with that seems to be, and I'm really kind of curious as to, because I've heard the whole thing is the SSIS computer system, which is the Social Services Information System, which is from actually 1994, I think it was put together, and it's just a mess. It's just.
Some green screen, yeah.
And so it's keeping people just so non-productive. They're just sitting on their screens trying to, and then there's tons of spirals, spins of death that, it's just.
I think it's like
needs to be a
average is like
priority.
8 minutes a page to load. So, I mean,
It's absolutely ridiculous. And then they did talk about some infrastructure and transportation issues. That the greenhouse gas is another thing that was part of that, as well as the public waters inventory. They didn't really explain that. That was a little of a new idea for me. And then they did talk, they had Isaac Schultz, who was one of the representatives, who I thought he was pretty impressive. He knew his stuff. And they were talking ATV restrictions, how a lot of these ATV restriction folks are coming from the cities who've never been on one, have no idea what they are, but they're authoring legislation regarding it. And it's like, these people, proposing this legislation in the metro have no idea what they're talking about. And it's kind of scary. And just, so part of it was to try to educate them and try to encourage them to come out and see what contributes to their recreational offerings in different parts of the state. They also did talk a little bit about sanctuary counties, which I thought was kind of interesting, that some of the western guys were like, how the heck did we ever get on this list? And I don't know if they ever had an answer, but I did, pull up the map, and we are not. But I'm not sure. Some of them, well, Candy Ojai is. And
They passed a resolution.
well, they did. Interesting. So,
to be
On it.
to be on.
We had it up for discussion and then it never came to fruition.
Died for a lack of second. Or a lack
And,
of a
and
motion.
instead,
maybe.
we came up with a new county board policy for the county administrator to review items like that.
got
Right.
it.
That was over the grants.
I honestly don't remember.
I don't know if those two are tied, but that is what we have. We have a policy in place that has us take a look at, provide standards for when we would adopt resolutions in support of certain political issues.
And then another thing is they bring up was which was interesting. They were talking about the NPR survey about rental issues, and I'm like, shortly after that, I pull, here's Andrew's email about it. So he's already answered, and so that was all good. And one guy brought up a concern or was asking, do we somehow monitor land purchased with Chinese interests? And I was like, well, I'll just bring it up. I don't know if that's what the deal is, but.
There was no discussion about the death penalty, though.
Not
No,
that
Chinese land would have taken over that. I can tell that.
Yeah,
not
you
to-
probably,
not to
I
pick
don't
on
even
your-
remember who it was
not to
because
pick on your
his
report,
name
but
was
I can
not
tell
on
when
there.
you're getting to the end of the meeting, when the topics
Yeah.
start to change, it's like, there's always a couple interesting.
Well, you're the veteran there, Steve.
I bring up the death
And I
penalty.
appreciate you taking it yesterday, because I had
Oh, no,
a
I'm
conflicting.
happy to do it. So.
I bring up the death penalty because the first one that Steve got me to go to, that was one of the main agenda items, was the death
It
penalty.
comes up every once in a while if we're gonna adopt the death penalty as a platform item, and it's like,
So we joke about that, Darren. That's-
Gotcha. The other question I'm gonna just ask you about the Emergency Services Board on the 26th.
yes. I will
And there's
be there.
there is, and I was wondering about being there because they're doing a new commissioner training
Oh,
that
yeah,
time as well.
Yeah,
So
if you wanna
that's
come,
where
that
I'm
would be
assuming
good.
that I'll be a part of that.
yeah.
Okay.
'Cause that's at 1 o'clock at St. Cloud.
Yep. So that's all I've got, Mr. Chairman.
Okay. I'll try and be brief, and actually Darren touched on some of the things. was in DC on the 4th, so I missed the board meeting. I did watch it all. And, the one thing I would say, those mics, unless they should be slid a little closer to on the recording,
hear on it.
if you lean back at all there, and I know I'm guilty of it here, I tend to lean back, but,
They are now Velcroed down so that people can't move them. Because what would happen is
They
people would
push
move them forward to create space for whatever paper they have, and then they would move away. So,
Sure.
yes, it's been a issue that
The
we're.
old, the old Velcro trick.
duct tape. All right. But my first time going to NACO, and actually it was really good, you know, kind of drinking from the fire hose quite a bit too. But they had us running. It went on Friday night, Saturday, and Sunday. We had meetings all day and different breakout sessions. I'm on Ag and Rural Affairs Committee. Have been for several years, so this was the first in-person meeting that I was at. And a lot of their topics was interesting. It's solar and wind issues on rural ag land, and also healthcare and rural. One of the resolutions that they brought forth was to have a pharmacy every 10 miles in rural areas. Could get some, you know, obviously where there's communities, some areas it's 60 miles between a community too. So I
They
mean,
can just put them in a Dollar General. I think there's one of them every time.
Right?
Wow, that is a great problem solver right
There
there.
you go.
There you go.
two
The lid's already
cactuses
there.
and a Dollar General.
There
right?
you go.
But no, so a lot of what was interesting was a lot of the national issues are what we deal with here. You know, similar here, energy. There's a main transmission line was another one that's going from New Mexico to Canada.
Wow.
That right away is varies from 5 to 15 miles wide. So there's a lot of angst, if you will, or energy behind that one. But it was a really good conference. And yesterday we had a Zoom executive meeting yesterday morning at 10 o'clock, and I was glad because we had about 15 hours between the AMC Ledge Conference and then getting on a plane and going to NACO. And I was really tired when I got home for a few days. And that's what Mike Slavic said. He goes, I'm not quite recovered from all that yet. And but I guess that only happens once every 10 years because they have planned these out so far that NACO and Ledge are next year. I think NACO is first, and then there's a week in between for AMC's Ledge Conference. But one of the biggest things we did in NACO was and this was, I give Barb Weckman-Brecky credit out of Scott County. She got me to hop on this along with Todd Patzer. And that was the assessments we do for HHS. You do an annual assessment. And one of the things that we worked on, we met with all our legislators out in DC to move that to a once every 3 years, because there's also 7 other points throughout the year that social services, family services meets with these individuals and has an opportunity at any time to request an assessment if they need it currently. So that redundancy, it takes about 15 hours of labor to do an annual assessment. So that would be a 65% reduction in that labor cost. And I talked with Tina on that, and she said that would be huge. And then using the system, SSIS and Maxis to do that too is doubly. So we worked with our federal legislature because the state tells you, well, the feds got to change it. So we worked with them, and Brad Finstead, Representative Finstead, said the next morning we seen him again, and he said he already talked to whoever the lead was on that, and he said, why wouldn't we change that? So we got real positive feedback on that, and our approach it changed our approach. Looking forward to executive committee, we were talking about, when we go to DC to pick, very selective topics, and try not to go to DC and ask for money, but ask them to relieve some legislation to make our lives easier. And that allows us then the opportunity to for lack of a better word, leverage the state legislature to then make changes here, because a lot of times we get pinned between the state and the federal. The SSIS, that's something we talked about at Ledge Conference. For some reason, there seems to be resistance at DHS to make an upgrade, and I don't think anybody's really identified why. But there's been dollars floated around at different times. I think they've got $100 million of a $200 million project still sitting in reserves they haven't utilized. So like Matt Hilgart has talked to them about shift the allocation of those funds into updating that software, because that's another, just a couple changes like that would be huge to our overall workload here. So them were the main targets. Ledge Conference, we met with the governor's office and talked about his budget, and that was a heated discussion for half an hour. And the main topic, Julie Ring made a very good point. She said to the governor, if county government is not at the table when you're discussing these shifts, she goes, then it becomes a property tax issue. She goes, unless you let us in the room to have these discussions and work through these issues, she goes, then it's really about property taxes. And counties are gonna be upset, and really all 87 are upset, so we'll see where all that goes, and of course, the legislature all tied up and having their pushing and shoving matches. I'm not sure what's gonna come out of this budget process, but. Then I got home, and the next night I went to Watkins and went to an XL Powerline meeting. And that's, I'm getting letters in the mail on different things from residents that are pushing back against XL, and the Public Utilities Commission. We'll see where that all leads here in the future, but it's good to be in the room and hear their concerns anyway. I went down to St. Paul then on the 11th and testified in the House for public safety. Gave testimony on Allied Armor radio systems, upgrading that. That was a bill sponsored by Representative Jeff Backer. And then on Friday the 14th, I was in St. Paul for AMC. They have the Big Four, so it's League of Minnesota Cities, AMC, Township, and school boards all get together quarterly to just have a conversation and compare notes. On all the executive boards get together and compare notes and work on things collaboratively if we can. Just a lot of it to do with different, of course, our school boards operate differently, but at the same time, similar to county government, but a lot of grants and things like that. And then Mike Williams from Stearns County, the administrator, gave a presentation on the role of boards and administrator and administration, and how it affects good governance, which was a pretty interesting conversation. And then yesterday we had an executive board Zoom and kind of recapped NACO and AMC, and then planned next week, the 26th, 7th, or the 26th, 7th, and 8th is a leadership conference, which you probably all, it's up in Grandview. You should have seen an invite on that if you didn't, but that's an optional thing. But we have our AMC board meeting at the end of that on Friday, so that'll be next week. And I have reentry services for public safety this week on the 20th, and that is how people come out of jails back into the workforce, if you will. And then we also continued next week. I'll have a meeting on 2911, which is the rules committee for how we house inmates, so. That was a lot. It was a busy month, I can tell you that. But other than that, happy National Ag Day, and thanks to everybody who promotes agriculture in Meeker County. It's a big part of what we do.
Thank you, Steve. Would you hand me that card from
Oh,
someone? Yeah, the one thing I've learned over the past 4 years is we got all 87 counties have very dedicated county commissioners, but there are some that are involved in everything and really work hard for things that benefit Minnesota County. So thank you to all of them. And our Steve is one of them by being secretary treasurer of our state organization of AMC. He brings a lot of credibility to Meeker County by doing so. So thank you, Steve, for that.
thanks, Paul.
So Prime West, as Beth gave that report, I only want to add one thing, and that is about Karma. When we got the update, they are standing in line to sign on to this bill, both sides. So it'll be a bipartisan bill coming out. Scott was very pleased with the reception. It still didn't have bill numbers. It was still in, I think it's out there now, if I read correctly, Beth, but
I don't know.
yeah. It did not have bill numbers. It has a process it has to go through. So the bill's all written. What do they call that? A rewrite or?
Yeah, I don't know.
Has to go to some
Some
state
process it has.
office for a rewrite before it can be.
Goes to the reviser.
Fiscal,
The reviser.
Revisal, that's it, yes. So, it should have been out and probably does, I haven't seen notice, but it'll be out and it will have a lot of support. Tuesday was Township Day, where all of our townships elected new supervisors and clerks and treasurers for their group. I always try to get to as many as I can on that day. I was down in Cedar Mills, and that was an interesting meeting. One thing I want to bring up from that meeting is they had folks who were doing work on culverts and so forth on their own without township knowledge. And one of the issues there is without proper notification, if there's an emergency phone call, one of the routes could run right into a roadblock because they weren't informed that a road was going to be closed for a day. So that was a big issue, and they're going to take some steps to ensure that does happen. I also went to Collinwood, and they had a really good turnout there. 103 people came to vote for they did have one contested supervisor position, but they had 103 people who came and voted. Much less amount was there for their annual meeting. But they always ask, I always like to go to these because they'll ask for a county update, and I can just give them briefly some things that are going on. And then I made my last stop at Ellsworth Township and snuck in the back, sat in the back there. They were almost finished with business, and they said, could we get a county update? And I said, sure. And the clerk said, now just remember, you are between us and adjournment. Keep it short. But I do think that I try to get different ones. Now, next year, I'll try to get to Greenleaf because I didn't get to them, Acton and Cosmos. So I'll do different ones each year. I try to do different ones each year. Then I had PAC the following day in Wilmer, and it was our annual meeting, which we go over all the things that were done over the past year. We celebrated a couple of individuals that have been with PAC for 30 years, I'm sorry, not 35. And Jolene is our financial person there and does just a wonderful job. I think you saw that, Steve, when you filled in for me at that meeting. I mean, it's juggling of all of those things that she has to juggle because they have to be in the right spots because they're grants and so forth. She does
And I think she's kind of coming into her own a little bit. Rochelle, right, was there for many
Rochelle
years.
was there for a lot of years.
Yeah, so she's relatively new in the position, but
Yeah, you're thinking of Sarah.
Oh.
Jolene is the finance.
Oh, yes,
Yeah,
her too.
but you're right, Sarah's
Well, I
really,
mean,
really.
they got a
coming.
good staff. And
Yes, we got a great staff, and we thanked them for that. They did give me an award, the Spirit of Collaboration Award from the PAC group. So that was
I'm
some,
starting to get awards.
I'm just, you know,
A statue or
I
a
was
gift
trying,
card or
I'd
what
like
was
to,
it?
I'd like to move on now, okay?
Scooter's copy.
I have questions.
And then on Friday, of course, I attended the Darwin Rod and Gun Club Smelt Fry, and it was excellent. So I'm just throwing that in as a tidbit. Yesterday, we had a CPT virtual meeting. We continue to grow there. Not a joint owner, but a new user is in Faribault. They have taken our tax program, converted to it, so we've gained that one. We also have another county in North Dakota that has came to us and said we'd like to join. So we continue to grow. We grow, it's in that $50,000 a month is what we keep adding. But this, just as a reminder, this is our company. We own it along with 23 other counties. We are the owners of this. And it's doing very well. So then I want to read this from Southwest Minnesota Arts Council. Their Meeker County Commissioners, thank you for the donation of $1,200 to the Southwest Minnesota Arts Council. These funds help us promote Meeker County as well as our 18-county region. And signed by Darlene Kudelnacki, Meeker County Representative. So they sent that thank you card, and I wanted to make sure that that was acknowledged out there. So other than that, I have nothing else. If no one has any other business to come before us?
Mr. Chair?
Yes.
I just mentioned the retirement party for Paul Bukovich the other
Yeah,
day.
please,
and
please do.
A good crowd there at
The Moose.
Muddy Cow.
Muddy Cow.
Oh, yeah.
Can be a moose if you want it to be. But no, there's a good crowd, and it was good to have see Paul off, and we welcome Tina. And Tina actually Shank got put on this. Oh, I'm gonna forget. I put her on there as executive member, but it's the mental health.
It's an advisory group with AMC.
Yeah, I was gonna say consortium, but it's a group that she's working on through AMC, so it'll be good to have her. So we welcome Tina.
Also at the hospital board, they did, Mary Ellen mentioned perhaps we'll do a work session in April at the hospital.
Yes, if you,
Tour?
if you recall, at the last meeting when Mary Ellen was here, we had talked about wanting to get commissioners over there to do a tour of the hospital. She and I had also talked about wanting to do kind of she wanted to do like a bigger presentation about what the hospital does, services that are provided, so that all of you have a better sense of that. And so as she and I talked, the stars seemed to align, and well, let's do that meeting at the hospital, allow for that presentation, and then a tour right afterwards. So that will be our April work session.
Good.
Great.
And Mr. Chair, if I may, as long as we're talking hospital, I forgot about that piece, but Medicaid was brought up. And when we were in DC, we did talk to them quite a bit about Medicaid cuts and those effects on counties. And I was in contact with Andrew. I was out there trying to, because I knew we had Mary Ellen coming in, and I just wanted her to do some homework if there was anything that we needed to address locally or use as an example out there locally, because there's not too many county-owned hospitals left in the state of Minnesota, so.
None that do as well as we do anyway.
Oh.
Top 100.
And that's, we want to keep them going that way too. I mean, so.
I think the cuts, I mean, it's like Woodland said, Medicare or Medicaid, if that gets cut, it's gonna affect, depending where they cut.
Well, and to explain it a little deeper, Minnesota is one of 12 states that uses social service programs, if you will, to a broader or a large extent. And of them 12, Minnesota is like a gold star, one of 7 in that 12 that takes it to the highest level. So we're one of 7 states that uses Medicaid and programs to an extreme is the word I'll use, but at a high level. And so when they talk, and the main thing, I think most of it is headline news. It's, the big thing that gets everybody wound up is there's $880 billion projected to be cut over the next 10 years. And they can't always leave out the 10 years on the end of that statement, but it's over 10 years. And they immediately went, and it's through Commerce, and like, the name of the area they want to cut is part of Commerce. Well, Medicaid is in that area. And when they look at that area, it's also in there with Defense. I can't remember, there's some other areas that they're eliminating them as areas to cut money, so then they point to Medicaid and say, oh, they're gonna cut Medicaid. So a lot of it is headline news and talking points at this juncture. And of course, the Republican Party has said we're not cutting Medicaid, the president has said that, but it's a lot of conjecture at this point, back and forth, so we'll see what happens, but,
You gotta keep them riled up. It's important.
but that's kind of where the conversation is. But, it's kind of a wait and see. Right now, most of the things are not being cut. When they look at stuff, there's very little changes. There's some shifts in the way funding happening, but not really any drastic cuts at this point.
I think I sent something to everybody, blind copy did. It has a lot of good facts in there, little links to good facts about Medicaid. I think half of our issue is the myths, as you talk about. They leave out 2 words on a sentence and changes the whole dynamic of the sentence.
Yes.
But those little links in there provide some very, very good facts.
And I did see that.
And I think we need to remember that, so. Anything else?
I promise to be done now.
Okay. Hearing no further business, I will adjourn our board meeting for today. Thank you, everyone.
Thank you.
You have a short.
You have.
Yes, we're gonna go down to the